Welcome to Arise News, news channel, global briefing on COVID-19, the pandemic. Over the next 3 hours, we'll take an in-depth look at the deadly global crisis that is redefining the way we live and work. We have top experts standing by to share their thoughts and advice, and we're expecting Nigeria's President Muhammadu Buhari to address the nation on the crisis in the next few minutes. I am Rotus Odiri.
And I'm Adefemi Akinsoya. Now, the word unprecedented has been used a lot in recent weeks, and that's because the world has truly never seen anything like what we're currently experiencing. Billions of people are on lockdown, the global economy is in freefall, world leaders don't know what to do next. Health workers around the globe are battling to stop the virus in its tracks, but it shows no sign of slowing down.
All right, so this is a live map from Johns Hopkins, U.S. Research University, which has been tracking the spread of this new coronavirus. As you can see, there are currently almost 700,000 confirmed cases around the world, and more than 30,000 people have died. The pandemic has spread to over 199 different countries, but we need to remember that the vast majority of people who contract COVID-19 go on to make a full recovery.
Well, that is good news. For a long time, especially as we've seen this virus spread across the world, there has been this feeling that it is a death sentence, but we know better. We do know that the vast majority of people, as you said, do survive. It does not kill them, but that being said.
And we've noticed the number of people haven't actually put figures to the people who have recovered. They continuously talk about the number of infected people. They continue to talk about the number of deaths. Actually, globally, 142,000 people roughly have recovered from the virus. So as long as, and I guess we're going to get into this as the show progresses, but as long as people follow the necessary instructions for hygiene, they should actually recover. Like Justin Trudeau's wife, the news was that she's recovered from the virus.
And that's because she was able to isolate as soon as possible after her diagnosis. And I do think, talking about the death toll and the fact that it isn't always life-threatening, even though it is a serious virus, there is a lot that we're going to talk about in terms of debunking these myths attached with coronavirus.
So many myths.
One of them is the fact that younger people are somehow not susceptible, or it's not as life-threatening to them as perhaps to elderly or to the young. But in terms of long-lasting effects, there are things such as scarring on the lungs, because as we know, it's a respiratory virus that attacks your lungs. And also the fact that you might need physical therapy for a long time to learn how your body works again. So in as much as we can be rest assured that it isn't always a death sentence, it is absolutely very serious and has long-lasting effects on the body.
Another myth is that folks that look like you and I, people of African descent, aren't affected by. That's another myth that we need to put.
That's a very big myth. That's a very, very big myth.
That we need to put to rest. What else? It doesn't. The virus doesn't survive in hot climates.
Again, another myth. Well, we'll definitely put this to our medical and our healthcare professionals to talk about this at length. But one thing we do know that we can be doing to protect ourselves is definitely washing your hands and keeping a social distance, which is exactly what myself and Rotus are doing here.
You're over 6 feet away from me, I believe, or just about 2 meters. Yes. So Arise News has been following that, where everybody in the studios has been maintaining that necessary distance, and we've also constantly been broadcasting to our viewers across the world to maintain social distancing, and also passing on messages from governments around the world with respect to the necessary things that they have to do in order to get through this particular pandemic.
Definitely.
We're crossing live now to a special address on COVID-19 by the President of Nigeria, Muhammadu Buhari.
So we'll get fed back.
Fellow Nigerians, from the first signs that coronavirus or COVID-19 was turning into an epidemic and was officially declared a worldwide emergency, the federal government started planning preventive, containment, and curative measures in the event the disease hits Nigeria. The whole instruments of government are now mobilized to confront what has now become both a health emergency and an economic crisis. Nigeria, unfortunately, confirmed its first case on 27 February 2020. Since then, we have seen the number of confirmed cases rise slowly. By the morning of March 29, 2020, the total confirmed cases within Nigeria has risen to 97. Regrettably, we also had our first fatality, a former employee of PPMC who died on 23rd March 2020. Our thoughts and prayers are with his family in these very difficult times. We also pray for quick recovery for those infected and undergoing treatment. As of today, COVID-19 has no cure. Scientists around the world are working very hard to develop a vaccine. We are in touch with these institutions as they work towards a solution that will be certified by international and local medical authorities within the shortest possible time. For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus. Since the outbreak was reported in China, our government has been monitoring the situation closely and studying the various responses adopted by other countries. Indeed, the Director General of the Nigerian Center for Disease Control was one of the 10 global health leaders invited by the World Health Organization to visit China and understudy their response approach. I am personally very proud of Dr. Ihekweazu for doing this on behalf of all Nigerians. Since his return, the NCDC has been implementing numerous strategies and programs in Nigeria to ensure that the adverse impact of this virus on our country is minimized. We ask all Nigerians to support the work the Federal Ministry of Health and NCDC are doing, led by the Presidential Task Force. Although we have adopted strategies used globally, our implementation programs have been tailored to reflect our local realities. In Nigeria, we are taking a two-step approach. First, to protect the lives of our fellow Nigerians and residents living here, and second, to preserve the livelihoods of workers and business owners to ensure their families get through this very difficult time in dignity and with hope and peace of mind. To date, we have introduced healthcare measures, border security, fiscal and monetary policies in our response. We shall continue to do so as the situation unfolds. Some of these measures will surely cause major inconveniences to many citizens, but these are sacrifices we should all be willing and ready to make for the greater good of our country. In Nigeria's fight against COVID-19, there is no such thing as an overreaction or an underreaction. It is all about the right reaction by the right agencies and trained experts. Accordingly, As a government, we will continue to rely on guidance of our medical professionals and experts at the Ministry of Health, NCDC, and other relevant agencies through this difficult time. I therefore urge all students to adhere to their guidelines as they are released from time to time. As we are all aware, Lagos and Abuja have the majority of confirmed cases in Nigeria. Our focus, therefore, remains to urgently and drastically contain these cases and to support other states and regions in the best way we can. This is why we provided an initial intervention of 15 billion naira to support the national response as we fight to contain and control the spread. We also created a presidential task force to develop a workable national response strategy that is being reviewed on a daily basis as the requirements change. This strategy takes international best practices but adopts them to suit our unique local circumstances. Our goal is to ensure all states have the right support and manpower to respond immediately. So far in Lagos and Abuja, we have recruited hundreds of ad hoc staff to man all our call centers and support our tracing and testing efforts. I also requested through the Nigerian Governors Forum for all state governments to nominate doctors and nurses who will be trained by the NCDC and Lagos state government on tactical and operational response to the virus in case it spreads to other states. This training will also include medical representatives from our armed forces, paramilitary, and security and intelligence agencies. As a nation, our response must be guided, systematic, and professional. There is a need for consistency across the nation. All inconsistencies in policy guidelines between federal and state agencies will be eliminated. As I mentioned earlier, as at this morning, we had 97 confirmed cases. Majority of these are in Lagos and Abuja. All the confirmed cases are getting the necessary medical care. Our agencies are currently working hard to identify cases and people these patients have been in contact with. The few confirmed cases outside Lagos and Abuja are linked to persons who have traveled from these centers. We are therefore working to ensure such interstate and interstate movements are restricted to prevent further spread. Based on the advice of the Federal Ministry of Health and the NCDC, I am directing the cessation of all movements in Lagos and the FCT for an initial period of 14 days with effect from 11 p.m. on Monday, 30th March 2020. This restriction will also apply to Ogun State due to its close proximity to Lagos and the high traffic between the two states. All citizens in these areas are to stay in their homes. Travel to or from other states should be postponed. All businesses and offices within these locations should be fully closed during this period. The governors of Lagos and Ogun states, as well as the minister of the FCT, have been notified. Furthermore, heads of security and intelligence agencies have also been briefed. We will use this containment period to identify, trace, and isolate all individuals that have come into contact with confirmed cases. We will ensure the treatment of confirmed cases while restricting further spread to other states. This order does not apply to hospitals and all related medical establishments, as well as organizations in healthcare-related manufacturing and distribution. Furthermore, commercial establishments such as A, food processing, distribution and retail companies, B, petroleum distribution and retail entities, C, power generation, transmission and distribution companies, and D, private security companies are also exempted. Although these establishments are exempted, access will be restricted and monitored. Workers in telecommunication companies, broadcasters, print and electronic media staff who can prove they are unable to work from home are also exempted. All seaports in Lagos shall remain operational in accordance with the guidelines I issued earlier. Vehicles and drivers conveying essential cargoes from these ports to other ports of the country will be screened thoroughly before departure by the port's health authority. Furthermore, all vehicles conveying food and other essential humanitarian items into these locations from other parts of the country will also be screened thoroughly before they are allowed to enter these restricted areas. Accordingly, the Honorable Minister of Health is hereby directed to redeploy all Port Health Authority employees previously stationed in Lagos and Abuja airports to key roads that serve as entry and exit points to these restricted zones. Movements of passenger aircraft, both commercial and private jets, are hereby suspended. Special permits will be issued on a needs basis. We are fully aware that such measures will cause much hardship and inconvenience to many citizens, but this is a matter of life and death. If we look at the dreadful daily toll of deaths in Italy, France, and Spain. However, we must all see this as our national and patriotic duty to control and contain the spread of this virus. I will therefore ask all of us affected by this order to put aside our personal comfort to safeguard ourselves and fellow human beings. This common enemy can only be controlled if we all come together and obey scientific and medical advice. As we remain ready to enforce these measures, we should see this as our individual contribution in the war against COVID-19. Many other countries have taken far stricter measures in a bid to control the spread of the virus with positive results. For residents of satellite and commuter towns and communities around Lagos and Abuja, whose livelihoods will surely be affected by some of these restrictive measures, we shall deploy relief materials to ease their pains in the coming weeks. Furthermore, although schools are closed, I have instructed the Ministry of Humanitarian Affairs, Disaster Management, and Social Development to work with state governments in developing a strategy on how to sustain the school feeding program during this period without compromising our social distancing policies. The Minister will be contacting the affected states and agree on detailed next steps. Furthermore, I have directed that a 3-month repayment moratorium for all trader money, market money, and farmer money loans be implemented with immediate effect. I have also directed that a similar moratorium be given to all federal government-funded loans issued by the Bank of Industry, Bank of Agriculture, and the Nigerian Export-Import Bank. For on-lending facilities, using capital from international and multilateral development partners, I have directed our development financial institutions to engage these development partners and negotiate concessions to ease the pains of the borrowers. For the most vulnerable in our society, I have directed that the conditional cash transfers for the next 2 months be paid immediately. Our internally displaced persons will also receive 2 months of food rations in the coming weeks. We also call on all Nigerians to take personal responsibility to support those who are vulnerable within their communities, helping them with whatever they may need. As we all pray for the best possible outcome, we shall continue planning for all eventualities. This is why I directed that all federal government stadia, pilgrims camps, and other facilities be converted to isolation centers and makeshift hospitals. My fellow Nigerians, as a government, we will avail all necessary resources to support the response and recovery. We remain committed to do whatever it takes to confront COVID-19 in our country. We are very grateful to see the emerging support of the private sector and individuals to the response, as well as our development partners. At this point, I will ask that all contributions and donations be coordinated and centralized to ensure efficient and impactful spending. The Presidential Task Force remains the central coordinating body on the COVID-19 response. I want to assure you all that government ministries, departments, and agencies with a role to play in the outbreak response are working hard to bring this virus under control. Every nation in the world is challenged at this time, but we have seen countries where citizens have come together to reduce the spread of the virus. I will therefore implore you again to strictly comply with the guidelines issued and also do your bit to support government and the most vulnerable in our communities. I will take this opportunity to thank all our public health workforce, healthcare workers, port health authorities, and other essential staff on the front lines of the response for their dedication and commitment. You are true heroes. I thank you all for listening. May God continue to bless and protect us all.
well, that was definitely well, I wouldn't say expected, but there was lots of anticipation. Lots of people wanted to hear from Nigerian President Muhammadu Buhari, definitely, and he did in fact deliver in terms of what he said. I think the most significant part of what the president said was the interstate lockdown, a curfew he announced in Lagos State, in Abuja, and also in Ogun State, and that is, of course, because of its geographical proximity to Lagos. We do know that Lagos and Ogun State share a border, so naturally the curfew falls over those two states and Abuja.
And it's for 14 days.
14 days
he did say that, of course, there are certain particular sectors of the economy that are going to be exempt from this. He mentioned hospitals. He mentioned people in the medical services, manufacturing, distribution. He also talked about food, petroleum distribution, power generation, private security companies, and fortunately for us, he says media broadcasters, if you can prove that you're not able to work from home. Adifemi and I don't have this fancy Arise studio at home, so we have to be here. And so those, and also telecoms as well.
Absolutely.
And the seaports, he also said the seaports are to remain open as well during this period, and it's going to be for 14 days. The reason why the president said that this lockdown is happening is because they need to track the number of people that are infected and quarantine them as well. So that's the major reason why this is happening.
Absolutely. Well.
You're watching the Arise News Channel global briefing on COVID-19, the pandemic. We're taking an in-depth look at this deadly global crisis that is redefining the way we live and work.
Yes, well, in this show, we'll dispel the myths and give you the latest facts, the information that you need right now. We have top experts from the UK, the United States, and of course, from here in Nigeria, standing by to share their thoughts and advice.
We'll be marking in detail how President Buhari's speech will affect Nigerians. But first, let's begin with a look at the situation around the world right now from Arise News anchor Charles Nyagulu.
Spain set a new record on Sunday, one it would never have wanted to claim. The Health Ministry announced 838 new deaths from the virus. It was the country's highest daily jump in fatalities, bringing its total to more than 6,500. Things have gotten so bad, an ice rink in Madrid has been converted into a morgue. But the worst affected country in the world isn't Spain, it's Italy. More than 10,000 people have now died there. Pages upon pages of local newspapers are taken over by obituaries. That's despite there being less than 100,000 cases in the country. It's the highest death rate on the planet and is being attributed to a large elderly population and a low testing rate.
The number of infected subjects is surely higher than what officially comes from the declared evening bulletin, because there are patients who have quarantined themselves who have not been tested. They are at home and they are healing slowly. There are subjects who have probably got the virus for sure. They didn't notice it, they got over it. So the number of infected people is absolutely larger than said.
Turning away from Europe, and Iran has by far the worst outbreak in the Middle East. President Hassan Rouhani has blamed US sanctions for limiting his ability to fight the outbreak. Satellite images show mass graves for those who have died. But the scale of misery isn't confined to mourning the victims of this virus. Millions of people have lost their jobs as businesses close their doors. In the US, nearly 3.3 million filed unemployment claims in just 1 week. The government there expected things to be bad. Nobody had any idea it would be this bad. Stock markets around the world are in meltdown and industry has ground to a halt. The price of oil has plummeted, meaning economies depending on this resource are struggling. Some populations are more vulnerable to this outbreak than others. A strict lockdown has been imposed on the Rohingya refugee camps in Bangladesh. And there are fears for those living in camps across Africa. Already displaced by violence, there's now an invisible killer to fear. An outbreak in any of these camps, where there is limited access to clean water and health, would be absolutely disastrous. Confirmed cases across Africa are still fairly low, although some countries have imposed restrictions on movement, including South Africa, which has a 3-week lockdown in place.
It's a challenging situation for all countries in Africa, and the international community, I think, and for all countries of the South and low and middle income countries, need support. And the North must, while dealing with a massive crisis in its own regard, must move to protect the South, because nobody is safe until we are all safe.
The United States is the new epicenter of the outbreak, with around 125,000 confirmed infections. There's eerie scenes as officials struggle to contain the spread. Empty streets in the usually bustling Manhattan. In the UK, there's warning things will get worse before they get better. On Saturday, one of the government's top advisors said the country needs to stay in lockdown until June to avoid the worst effects of the virus. But over in Wuhan, the Chinese city where this all began, things are cautiously returning to normal. The world could learn a lot from what's happened in Asia. South Korea successfully flattened the curve, putting in place rapid and extensive testing combined with tracing the contacts of confirmed cases and notifying them to contain the spread. The number of sick people is decreasing and the number of recovered patients is on the rise. Now the question is whether other governments can emulate that success. Charles Anyegolu, Arise News, Abuja.
All right, you're watching Arise TV's global report on COVID-19, a global pandemic. If at any point throughout the show you have questions for our guests, feel free to get in touch on our social media. We'll do our best to get these answered for you later in the program. It's on our screen right now. Twitter is Arise TV, @Arise TV. YouTube is youtube.com/Arise News. Instagram is @Arise News Official, and Facebook.com/Arise TV News.
Yes, well, Alex Lightman now is a writer, entrepreneur, educator, and U.S. government policy advisor in technology and trade. He joins us live from Los Angeles.
Sean Griffiths is an emeritus professor at the Chinese University of Hong Kong. She also joins us live from London.
Well, a very big welcome to you both. Thank you for joining us on this special version of our show. If we were to begin with you, Ms. Griffiths, the origin of the virus, if you could tell us how it started and how it first spread throughout the world.
Well, it's believed that the virus started in Wuhan, in the wet market, where, very similar to SARS back in 2003. when the thinking is that the reservoir is bats, and that it then transferred via an intermediary host to infect people. Now, that's just the thinking at the current time, based very much on the thinking from the experience of SARS, when it was the wet market in Guangzhou, which was the origin. And the important thing about this virus is that it's leapt from, it's passed over from animal species into man and successfully then transferred between human beings. And that's what makes it a very tricky virus, because it's new into the population. We don't have immunity. We don't absolutely understand it. The scientific community has globally has come together to try their best to produce vaccines, to look at which antiviral drugs might be good treatments, but we are dealing with something that we don't really understand. And so that's really the situation we're in. And there's been a lot to learn from Wuhan. I think we heard your president talking about the visit from the WHO to Wuhan, where the experience of treating the patients, the clinical experience, the scientific experience was shared. And that knowledge has been very helpful to the rest of the world, as other countries have faced increasing numbers and had to put into place policies appropriate to their situations.
Okay, without focusing too much on Nigeria or the UK, Dr. Griffith, which we're about to do in-depth segments on, what are the challenges that the world is facing as far as millions of people being told to stay inside, including about 1.2 billion people in India, for instance?
The difficulty with staying inside, as we in the UK are now experiencing, is that you break down social networks and you have to reinvent ways in which communities can aggregate together. But it's probably the most important thing here is the economic impact. People who are self-employed are struggling to survive. So governments need to put into place adequate support for the vulnerable groups. They need to put into place a free healthcare system so that the care is accessible for people who need it, and they need to put into place strategies to help with people looking after their children, people looking after the elderly. All of these, we have to re-gear our societies. And I think possibly one of the things that's really been very difficult for people is if you are self-employed, where do you get the money for your next meal from? How does the rest of society come together to enable you to actually look after your children, your families, your loved ones in this sort of situation?
Absolutely. Those are definitely the questions that need answers. Alex Lightman, if we were to bring you into this conversation here and slightly change gears, we know that there have been massive layoffs. There have definitely been closed companies and establishments. People are out of work and desperately in need of financial assistance. What do you say to the state of the economy now as we're battling this COVID-19 virus?
Well, this is the most expensive problem that we've ever experienced. We have the example of influenza, the Spanish flu, so-called, around 1918, 1920 or so. And that hit us pretty hard, but we weren't as globally interconnected at that time, and we didn't have so much spending on healthcare. A lot of people were used to taking care of themselves, used to having their entertainment, being with their family. You had grandparents and parents and children all in one home or a household or extended household. And now we're a lot more fragmented, a lot more people living alone, a lot more people living with just pets. And so we have had three big problems economically at one time. The first is a supply shock. All of a sudden, the ships stopped moving things between countries. The second thing is a demand shock. Probably 80% of industries have experienced something like a 50 to 80% drop. We've never seen anything like that in history. And the third thing is a market shock. All of a sudden, people are panic selling stocks and they're looking for a flight to safety. And meanwhile, the dollar is the reserve, U.S. dollar is the reserve currency, and there's a dollar liquidity crisis. So there are over $3 trillion of loans made outside of the U.S. where the repayment of the loan is required in dollars, and now the dollar has shot up in value. It's shot up against virtually every currency except majorly except for the Japanese yen. I was looking at a chart. It was up against 14% against the Mexican peso, for instance. So if you're in Mexico and you have a loan that you have to pay back in dollars, all of a sudden your loan cost is 14% right when your income is down. So we have these three crises, and it's very hard to unwind them. And then we have a kind of a fourth crisis, which is that people are not being given all the information that they need to survive and to take care of their own health. Because we hear that the medical establishment, hospitals, will be overwhelmed, and there are many things, which we can talk about right now if you'd like, that people can do to look out for their own health if they cannot access a hospital. I have a lot of faith in Nigeria. I've seen the movie 93 Days because Nigerians have seen this movie before. Everything that Nigerians learned, and especially people in Lagos, in dealing with Ebola, about washing your hands, not touching your face, not going near people who are infected, you have an advantage. You have a psychological immunity because you've seen it happen before, you've gone through the panic, you've gone through this feeling of terror, which itself can put someone in the hospital, and you've come through on the other side. So I think that the way that Nigeria handled your cases of Ebola in 2014, to just remember the lessons, remember what you did then, because you solved that problem. The United States has not had this problem for 100 years, so while everybody in Nigeria who's an adult knows what to do, almost nobody in America knows what to do. The single biggest thing that people are not doing, that they need to do, is to wear a mask. And the societies where mask wearing is normal and people do it all the time, Japan and Korea, Singapore, Taiwan, those societies have a much lower rate of infection. And I would just add to that, that I would say that people should be doing stinky masks. So this is a paper towel, and on it I have put clove oil and I've put thieves oil. So there are things that have antiviral properties that you can put between your breathing system and the mask, which can increase the effectiveness of it, at least in my opinion.
You know, Alex, it's really interesting that you've talked about makeshift alternatives for masks, for people to protect themselves. And I think that lends itself, Rosa, to the bigger question of healthcare systems and how they are on the verge of collapse. Sean, if we could bring you back into here, what do you think people can be doing to relieve healthcare systems around the world? Well, Sean, I don't think your microphone is on just yet. In the meantime, Alex... Oh, there we go. Oh, go ahead. Go ahead. If you can repeat yourself, Sean. Thank you.
Sorry. Yeah, of course. Basically, as Alex said, I think the important things are here that to start with, we all have a responsibility for hygiene. Hand washing, wash your hands, don't touch your mouth and your eyes, keep the surfaces around you clear. If you use a tissue, dispose of it properly or cough into the crook of your arm. Everybody needs to remember these messages because they will make a difference. In the UK now, we are in a socially distanced world. We all know that we shouldn't be within 2 meters of anybody else, and we are living in a very constrained way, working from home if at all possible. Schools are closed, universities are closed. We are only supposed to go out to go to the shops or to go to essential work or to go to collect medication or to have a walk for an hour a day. So we're living in a very different way. But if we all take this seriously, it will make a difference. That's the suggestion from the modelers who are modelling the advice to our government in the UK. So I think and I think these are universal messages. Alex was just giving those very similar messages. They're the same messages in China, they're the same messages in Africa. They're the same messages for us all. Hygiene, 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 very important messages. So we can do something. We can take responsibility for ourselves within the situation and understand why we're doing it. We're not doing it for ourselves, we're doing it for the vulnerable people in our communities, particularly protecting the elderly and the immunocompromised. So I think that we can all do that. In terms of other things that countries can do. If the UK was limited in its testing capacity, and I think when we talked a little bit earlier in this programme about numbers tested don't actually, or the numbers with a condition don't who've tested positive are really a reflection of the number of tests that are around. Right. And the testing capacity in the UK is being ramped up significantly, hoping to get to 10,000 a day next week from a much lower number, and then up to 25,000 a day, so that we can ensure that the antigen testing, that's have you got the disease, is available particularly to frontline workers, particularly to healthcare workers, so that healthcare workers can stay on the front line, don't have to take time off because they think they might be infected. The thing that we're really developing and looking to is the antibody test to know in the population how many people have been affected, so that you get your population data. Because what we have at the moment is we have the numbers of tests that have been done, which tell us who's had the disease, and who hasn't had the disease at that point of time. When the antibody test comes online, it will be able to give us a much more reassurance about people who've ever been affected, people who are hopefully potentially immune. And of course, again, when we're dealing with a new virus, it's complicated, but hopefully people who have had the infection and can go back into society and help particularly in the healthcare system, because as has also been mentioned, the healthcare systems, as the numbers of cases start to go up, get put under a huge strain. So I think that what we're seeing personal responsibility. The other thing that we're seeing is a huge community response. It was only last week that there was an official national community scheme was launched, and already there are something like 750,000 people who signed up to this charitable scheme. I've signed up, and you've got an app, and it goes live I think tomorrow. And people who need assistance, you as a local person will go to support somebody locally who may need their meds or their food or something collected. So there is also community responsibility as well as individual response, as well as the testing and looking at how fast it's spread in the community.
Absolutely.
And Professor Griffin, if we just stay with you briefly, if you can answer this, you're talking about responsibilities to different parts of the community. Or what about the responsibility for healthcare workers? Because it's been said that they're not getting the protection that they need. Many are catching the virus and are dying. Well, what's your take on what can be done to protect healthcare workers a lot more, if you can, briefly?
Yes, I mean, I think it's really essential that there are adequate supplies of protective equipment, PPE, personal protective equipment, and there was definitely a mismatch between the PPE available and the distribution of PPE and in the UK, and I think that that is actually a problem that is being resolved. I think Alex made the point that when you've been through something like SARS or Ebola, you're much more tuned into what's needed. So, for example, in Hong Kong, the availability of PPE, much larger stocks, much more availability. It's not been the case necessarily in Europe and in the UK. We've been slow to get the right PPE to the front line and to healthcare workers. We've been slow to get the testing to the healthcare workers. Those are both being redressed at the current time. It is very important to protect healthcare workers and social care workers and people looking after elderly people's homes. It's just one of those things that I'm afraid we've been a bit slow off the mark, but it's getting there. It's getting better, and maybe that's something that other countries will be doing better.
Alex, if we could bring you in just briefly, I want you to give us a bit more information on the fact that some countries have handled this crisis in the right way. I know that you've said that Nigeria has been making positive strides, but if you could expand on that point.
Sure. Were you talking to me?
Yes, you, Alex.
Great. Yes. So I have a Nigerian friend. I talked to Jutta Mate. He's a director. I hear that he's well known in Nigeria, and we had a conversation about this yesterday. So I guess I'll say what Nigeria is doing right. The president was absolutely correct to have this 2 week lockdown for the most populous areas where people are interacting the most. That's exactly right. Stopping traffic between neighboring states. This is very smart. And you're also smarter than the United States because you're doing this a lot sooner. We had to have thousands of cases before we started doing lockdowns in the states. So the states and the cities are leading. New York, California, Washington State. We have in the United States right now, as we are talking, 135,000 cases. In Nigeria, and we still don't have a nationwide lockdown. We still don't have a federal lockdown. In Nigeria, you're having the most affected areas when you have fewer than 100 people. That's incredibly commendable. That's very smart. And what you're going to do in Nigeria and in African countries that emulate the policies of your president, who's well informed, is that you're going to slow the RO. You're going to slow the spread. And the problem is that this is a gain of function virus. Viruses have been around for 1.5 billion years. And they have, we have still not really gotten serious about dealing with viruses. 70% of the people in the world have herpes simplex 1, which is a virus. And there is a treatment for that, which everybody should have taken by now and gotten rid of it. 70% or so of the people have cytomegalovirus. Again, that has no symptoms, but these things have a viral load. So overall, what I would add to the policies that have been talked about before is not only the separation and the isolation, and Jutamate is saying that he's isolated in a hotel in Abuja, and that basically I checked with him, and the kind of things that are treatments that are needed for these are available to people in Nigeria, some of them at low cost. So I think that that it's important for people to get inhalers with albuterol. I think that people should get things that are called a nebulizer. Basically, if they have to have an emergency kind of situation, you should have antiviral things like eucalyptus, clove, rosemary oil, and you should have those oils near your nose in a little cloth. You might look, if you can Google this on your phone, but you might see that during the Black Death, during the plague, there were people walking around with these scary-looking bird masks that had long noses, and those noses were there for a reason. They were filled with rags that were soaked in rosemary oil and clove oil and other kinds of oils that have antiviral properties. So the main thing that you can do at home is to think, what can I do to reduce viral load on my body? Because any other virus you're dealing with, if you're fighting off herpes simplex 1 and cytomegalovirus, and then you get COVID-19, which is based on the virus SARS-CoV-2, you want to reduce the distraction of your adaptive immune system and your innate immune system. You don't want them fighting multiple viruses. Also, you want to take a lot of vitamin C. You can take vitamin C up to the point where you have diarrhea, and you might go, oh, diarrhea is bad, because that's associated with Ebola. But that's the one thing that you shouldn't be terribly afraid of. You can spread through fecal oral channels, but it's good to have to go poop all the time, because that's a way of getting rid of viruses that are in your intestines. And the problem with this SARS-CoV-2, that causes a condition, COVID-19, is that it attacks not only the lungs, but it also attacks the liver, and it attacks, to some extent, they're saying that it attacks the heart.
Absolutely. Well, Alex, if you could just hold on to your thoughts just then. We will be coming back to you in a short while. It is time now for us to bring in another one of our guests.
Yes, indeed. Ladies and gentlemen, you're still watching the Arise News Channel Global Briefing on COVID-19, the pandemic, taking an in-depth look at this deadly global crisis that is redefining the way that we live and work. And of course, we're now joined by, from Lagos by Mr. Atedo Peterside. He's the founder of Stanbic IBTC Bank and the chairman of ANAP Foundation, which has set up a COVID-19 think tank, which is very necessary in terms of research and development to assist the fight against the pandemic. Mr. Peterside, you're welcome, sir. Thank you so much for joining us. Please, can you give us your take on the speech that we just heard from President Buhari with respect to his, the country's reaction, the federal government's reaction to the COVID-19 pandemic?
Yes, if you can hear me well. The first 3 words I will utter is, I am afraid. I'm not afraid for myself personally. I'm afraid for the 8 million people who are either unemployed, underemployed, or even more of them, who generally get their living by being on the streets. When the gentleman was talking about Ebola, they could do their business on the street. Ebola never threatened that. Please don't get me wrong. I was one of the first people on national television calling for social distancing. What I'm talking about now is that the whole strategy that we're talking about, let's be realistic. Lagos and Abuja, they are not just airports for those cities. Those airports are hubs. People fly into Abuja in the morning, same day they fly out to Calabar, to Benin, to Warri. Likewise, Abuja, people fly into Abuja. In fact, people who don't need to fly to Abuja are made to fly into Abuja every day in Nigeria, because simple documents and approvals elsewhere in the world you can do online. Those in Abuja insist you must come there in person. So if you do a calculation, the number of people who have been to Abuja and back needlessly, in Nigeria's case, between when we first got the virus and today, that number is phenomenal. Please don't get me wrong. I'm not saying that therefore we should not try social distancing or we should not try a more severe lockdown. I repeat, I was an advocate of shutting down all the international flights. I was an advocate of shutting down all the international flights because in a typical week, they were bringing in more and more planes from Europe, and it was clear to me that the virus was all over the place. But now let me tell you something about Nigerians. One or two people in government, not at the top, told me that the only time they were personally convinced that all international flights should be stopped was when they heard me saying it, not because I'm different, but because I have an aviation company and I have aircrafts that fly from Lagos to Dakar, to Cape Town, to Algeria, and I was begging my country that in the interest of Nigerians, please shut me down from going overseas and shut down everybody else. So the officer told me that, why would I be advocating that the government should ground all my aircraft and I'm going paying staff? People say usually that some of us go and advise government, vested interest. What is my interest in bringing my business down to zero revenue when I know that I have to inherit the bill of paying all the pilots, all the engineers, all my staff, because the government of Nigeria will not give me 1 naira. Please don't understand me. I don't want their 1 naira. My biggest concern is that go and look at their intervention policies. It's generally throwing 10 billion, 5 billion, 8 billion at some big businesses. My question is that what size of check did you throw to each, I repeat, each of the 80 or 100 million people who are unemployed or underemployed? See, there's some contradictions in the policy. Not that I'm saying the policy is bad, because we know that Italy, that did not embrace social distancing early enough, is the worst country in the world. Italy, that did not embrace lockdown early enough, has the worst case of Ebola. Conversely, China, South Korea, Singapore, and Vietnam, who were quicker and better to understand, embrace social distancing, had the discipline, and more importantly, China and Co had phenomenal tracking ability. The Chinese can tell you where every Chinese individual is. So you cannot dodge the authorities. In Nigeria, we had hordes of people flying into Abuja and flying out of Lagos and Abuja needlessly. We don't have the ability to track them properly. Even if you track them, by the time we find them, they have been in contact with 200 people. We have a problem running away from us. This strategy sounds like a case of, okay, we know that we are bolting the stable after the horse is already out, but let's just hope that the horses that bolted are not too many. But my fear and worry is that we keep on repeating Abuja, Lagos, Abuja, Lagos. Thereby making those in Port Harcourt, in Calabar, in Warri, in Zamfara, cheat themselves that it's a Lagos and an Abuja problem. I would like also the authorities to tell us the truth. The reason we have so few confirmed cases may be because they are only able to test X number of people in a day.
Okay.
If you test a very small number.
Well, I appreciate it, Mr. President. Thank you so much. I just wanted to quickly follow up with you on, you mentioned social distancing, and I wanted to ask you about the practicality of social distancing in Africa. If you look at some of the slums in South Africa, in Nigeria, where we have face me, I face you, where you had like 5, 10, 15 people sleeping in one room, how practical is social distancing in Africa? Briefly, if you can.
Yes, I'll tell you very, very briefly. The more severe the lockdown, the more difficult it is to sustain the lockdown. Conversely, the less severe the lockdown, the easier it can be sustained because we have safety nets. Unfortunately, as the less severe the lockdown becomes, which can be sustainable, the more the people interact, even in spite of your pretty social distancing. So you've got a trade-off. If the lockdown is too severe, it will fail because it cannot be sustained. If it is too weak, it might fail in the sense that they interact too much. You have to find the right balance. And it's not true that the right balance is the same all over the country. You have to study the particular environment. The right balance for Lagos may be different from the right balance for Abuja. Look, most people in the best of time don't need to go to Abuja. It is they're going to Abuja for.
Mr. Tendo Peterside, we thank you so much for your thoughts. If you could just hold on to those thoughts for a second. If we could just hold on, Mr. Peterside, for just a second. You are watching, our audience at home, you are watching the Arise News Channel's global briefing on COVID-19, the pandemic. We're taking an in-depth look at the deadly global crisis that's ravaging the way we look and redefining the way we see our lives and work. If you could stay with us for this short break.
Right.
Well, welcome back to our special report here on the global impact of the COVID-19 virus. Now, well, it's very interesting, this bit here, just Rotus.
Yes, indeed. From the confirmation of Nigeria's first coronavirus-related death and a handful of cases, that number is now almost at 197, to be precise. From the outset, Lagos has been at the epicenter of the virus in the country, consistently recording the highest numbers of confirmed infections. Directives promoting self-isolation and social distancing have become mandates across the country. We just talked about the practicality of social distancing. To analyze the situation here in Nigeria, we are also we're going to be going into exactly the effectiveness of this, right?
Absolutely, later on. But for now, there is a special report on the impact here in Nigeria. Let's take a listen. Monday started with panic and confusion at Lagos's Murtala Mohammed Airport as a ban on international flights came in, limiting the opportunity for cases of COVID-19 to be imported into Nigeria. Despite the acceptance that the travel ban from 13 countries, including Italy, Iran, and the United Kingdom, needed to be extended to total flights from all countries, there was still some anger amongst passengers.
The experience is tough for me, and I'm really annoyed. Unfortunately, I cannot travel today for no reason.
It's a last-minute trip because the one we already planned, they canceled it because of this coronavirus. So we had to book another ticket. Yes, urgently for the last flight.
Nigeria's top health authorities have reiterated the importance of self-isolation and a strict hygiene routine to limit the spread of the virus.
I again remind all citizens that this is not an assignment for government alone, but for all of us. I urge you to play your part in your own little way by taking social distancing very seriously as a mark of your individual social responsibility and your contribution to preventing the spread of the disease in Nigeria.
But there are still major causes for concern, as there are fears cases in Lagos alone could spike to more than 39,000.
It's spreading through a community. It can spread in an exponential manner, and such, if the social distancing strategy is not adopted by the community, well, as government, we have to make the provisions to accommodate the eventuality.
Thursday came with mixed reactions to the partial shutdown, which came into place in Lagos. Balogun Market was a shadow of its former self. To promote social distance, all stores except those selling food and medical essential items were closed. And for many who rely on daily pay, the empty streets meant empty pockets.
If I don't sell, if customer doesn't come to my shop, I don't make any living. So now I am just putting myself in the same shoe because there are a lot of people here in this Lagos Island who doesn't come out on a daily basis, they can't make a living.
And naturally, even though people can accept that social distancing is something that they should be doing, there's also the problem of how they're going to survive a 7-day period. There's a lady here who is selling food, so she is allowed to be on the street here in compliance with the directive, but she has her own story to tell.
Well, today is lovely, but there is no sales. There is no sales today because by now I will have make up to 5K. But for now, let me say, if I'm counting, I'm still counting 1.5. But I thank God all the same.
Central Bank Governor Godwin Emefiele announced the creation of the Nigerian Private Sector Coalition to address the COVID-19 crisis. Members of the coalition include billionaire businessmen Aliko Dangote, Femi Otedola, and Access Bank Managing Director Herbert Wigwe. Each member has pledged at least 1 billion naira to the fund, earmarked to address financial hardships and deploy resources to those in need. The private sector financial intervention continued into the weekend with the completion of a makeshift isolation centre on the grounds of Onikan Stadium in Lagos.
This is a reflection of the strong can-do spirit of Nigerians and, more importantly, the brand called Guarantee Trust Bank. As your governor, I am happy that GTB has seen the need for this collaboration, and they have worked tirelessly to ensure that we have this first-class facility.
We're in a very strange and awkward time. I mean, this is a time where we're facing a pandemic where the whole world is throwing in. And if you're fortunate enough to have the type of governor and the type of government you have in Lagos State, which is open-minded enough to collaborations, then this is the kind of stuff that can happen in record time.
The 110-bed facility was constructed by Guarantee Trust Bank, further underscoring the fact that Nigeria's battle against COVID-19 is a joint one. Well, to analyze the situation here in Nigeria, we are joined by Professor Akin Abayomi, who is the Lagos State Commissioner for Health. We're also joined by Dr. Yemi Johnson. He's the Chief Executive Officer of First Cardiology Consultants. And also we are joined by Dr. Abiodun Aluko, who is the Medical Director of Premier Hospitals here in Lagos. If we were to start with you, Mr. Health Commissioner, Professor Abayomi, thank you very much for joining us here. If we could start here, if you were listening to that report, we know that we mentioned the fact that cases in Lagos could spike as high as 39,000. Could you put that into context for us?
Yes, while the predominant cases we've been seeing in Lagos have been being imported, we believe that we're now beginning to see the early phase of community spread. In other words, the persons that have come in with the virus are now transmitting the virus to members of their family, to members of the community. So we're beginning to see a shift in the dynamic. And in so doing, we are now preparing for that dynamic process where the virus is going to start moving from person to person within Lagos. We do know now from the cases that we've been seeing, we're learning a little bit about the natural history of COVID-19 in the Lagos population. We're seeing a mixture of very mild symptoms or even subclinical symptoms ranging to moderate disease. We've not seen very much severe sickness yet, characterized by respiratory failure or organ failure, but that may just be a process of time, because we've just seen under 100 cases in the whole of Nigeria and about 44 in Lagos. So it may just be a matter of time. But we're worried about those subclinical cases, the persons who have very mild infection and may not know that they're infected. And I think when we identify a patient that is infected with symptoms, it's easier to track that kind of person. So the spread from person to person is more likely to happen from an asymptomatic or a mildly infected person. So when we do the modeling and we watch what's going on around the rest of the world, we expect to see a few thousand cases in Lagos over the next couple of months. But we've changed strategy now from contact tracing, which is ongoing. But our second strategy now is aggressive social distancing and physical distancing to interrupt the opportunity for the virus to move from person to person. Meanwhile, we're ramping up our isolation capacity. Every day we're getting more and more beds being commissioned. And we're preparing for this. We're training doctors, we're preparing the community, we're enlightening the community, we're recruiting volunteers, we're increasing our logistics. So we are preparing for a surge, and if that surge happens, then we may have the capacity to absorb it. If it exceeds our capacity, then we will move into a different strategy altogether.
Professor Abayomi, as far as that different strategy that you just mentioned is concerned, in order to combat this possible surge that you're expecting, your reaction, please, to the President Buhari's pretty much lockdown for the next 2 weeks. Is that supposed to aid your efforts in combating this surge, of course, of the complications in tracking down asymptomatic people that you've mentioned?
Well, I think the strategy there is twofold. One is to reduce, the virus can only spread if there is contact between people. So if you force people to reduce their movement, then the opportunity for the virus to spread, as we all know, is drastically diminished. But I think what's going on as well is that we're trying to limit the movement of people from state to state, especially the epicenters, which seem to be Lagos and Abuja. So we're trying to protect the rest of Nigeria and stopping patients moving or infected persons moving from the epicenters to other states in Nigeria. We do know that not everyone is fully prepared for this outbreak. It's taking everybody by surprise. And so we know that not every state is prepared. So we're trying to protect other states in the country. We're trying to protect the country as a whole from experiencing a very large outbreak.
Professor Abayomi, I know that we have another doctor, and we will come to you, Dr. Aluko. I just wanted to ask the Health Commissioner another question before we do cross over to you. Health Commissioner, one thing I want to clear up is the fact that we are well aware that the President's Chief of Staff, Abba Kyari, tested positive after returning from a journey to mainland Europe. He went to Germany. If we could shed a bit more light on that. We're hearing reports that he's been brought to Lagos for treatment. Can you confirm that?
I have no information on that. As far as I'm concerned, he's in Abuja. We communicate regularly, and that's the information that I have.
Okay. Thank you for clearing that up. Dr. Abiodun Oluko, who is the Medical Director of Premier Hospitals in Lagos, she's also joining us here. Thank you very much, Doctor. If you could give us your thoughts on private sector support. Before we came to you there, we played a report on an isolation center being built in Onikan Stadium here in Lagos that was in conjunction not only with the Lagos state government, but also with Guaranteed Trust Bank. That just highlights the fact that private sectors had been intervening in this crisis with its financial support. What are your thoughts on that?
Good evening, everyone. I think it's a wonderful thing that the private sector is trying to assist the public sector with containing and providing capacity for us to be able to work with this pandemic that we have. The problems are not only about isolation centers. They are about a lot of things. They are about a lot of information and misinformation. There's a lot of panic. There's a lot of fear amongst everyone. I represent the private practitioners. Private practitioners actually provide about 70% of the health care that's given in Nigeria. And so we have a great role to play. We find ourselves in the middle of this pandemic, essentially not prepared, essentially with having to do things without the required manpower that we need. We do not have the PPE that we need for our people. We have a system in place where patients just walk into the hospital. We don't have systems like those in the United States where the emergency room is clearly delineated and then the clinics are by appointments only. We have situations where patients walk in. Most times they may walk in for something and then you find out that there's a travel history that was undisclosed. We have our doctors feel threatened by the fact that they don't know, they're not protected enough by the protocols that are in place. They're not sure what exactly is happening. And that's really the sector that I represent. I don't represent the sector that is in business. I represent the private sector that is in the medical business. We are employing doctors. We are providing service to patients who are frightened. We are employing doctors who are frightened as well. And we ourselves are finding that it's difficult to continue to provide what it is that we need to provide so that we can assist in containing the epidemic or the pandemic in Nigeria. There's inability of our PPEs. I think the people that are donating generously should find a way to get these supplies directly to the people who need them. The people who need them are the people that are providing services to Nigerians. And 70%, like I said, of the health care that is given to Nigerians is actually given by private practitioners. So they do need some assistance. They need a lot of information. They need to know what to do with a lot of patients that just walk in the door and finally we find that they are high risk for having coronavirus. The testing that is supposed to be available has not been as forthcoming as we would like. And sometimes we are stranded with patients who don't know what to do. Those are the challenges that we are facing as private practitioners, especially here in Lagos. I'm honored to be sitting out here with the Honorable Commissioner. I'm hoping he'll be able to help us and answer some of our questions so that we can go back as private practitioners, to go back and do our medicine with far more confidence. Try to allay the fears of both our doctors and our patients and ourselves, that everything will be under control. And it is my hope that we get some more answers to some of these questions. And again, I would like to talk about the fact that a lot has been donated so far that we have heard about. The President said today that the task force is in charge of disbursing these donations. So we would like it to be done with the view that it is a pandemic. There's a sense of urgency about everything. Every minute, somebody is probably coming in contact with a coronavirus patient who is infectious, who they shouldn't be coming in contact with. If PPEs, if information, if test kits, if gloves, if masks, and all these things were quickly distributed. So my appeal is to the task force to please take this issue of dispersing funds and dispersing equipment and gloves and everything as a matter of urgency. That is my plea to them.
All right. Thank you so much, Dr. Aluko. We're going to go over now to Dr. Yemi Johnson, Chief Executive Officer of the First Cardiology Consultants Limited. Dr. Johnson, I understand you're certified in over 30 plus years in cardiology from Columbia University and Yale. You've practiced in California and North Carolina. I want to ask you about an article that I saw that's just about a day or two old in the New York Times. With the headline was, a heart attack? No, it was the coronavirus. And it states that cardiologists are seeing symptoms in coronavirus patients that are not respiratory, but actually cardiac. Can you speak to that, where we're seeing cases of the fallout of the coronavirus going into your area of expertise?
Okay, good evening. Well, I haven't read that article, but I do know the coronavirus does affect the heart. And, but in most cases, what happens is the coronavirus presents the usual way: fever, cough, shortness of breath. Then in the sick patients, it now does affect the heart. It can cause something called myocarditis. And when you get myocarditis, it means the heart is infected, is inflamed, and all sorts of things can happen, from pump failure to arrhythmias, which can cause sudden death. So yes, the heart is involved in some cases of coronavirus. But when you talk about New York, it's a different setting altogether. The system is now overwhelmed with corona patients. So if you come in with a heart attack in New York now, or in London, if you come with a heart attack, you are going to be assumed to have corona until proven otherwise. So some of the procedures you would have had done, like the best treatment for a heart attack is something called angioplasty. Now they're not doing angioplasty because they're scared of getting infected from the patient. So they will give medications, stabilize the patient, and then wait for the test results. And even in London, in New York, test results do not come back immediately. They take some time, a day or a couple of days. So that's where the cardiac problem comes. Now, talking about cardiac and Nigeria, my area is critical care, sick people. We have started to see some sick patients, not requiring intubation or ventilation, but we've started to see some sick people. The concern is, if this thing gets out of hand and we end up like New York or London, the hospitals that have critical care beds will now be overwhelmed with corona patients, COVID patients, and then when somebody comes with a heart attack or a stroke or heart failure, there won't be any space for him. So that's one of the concerns I have. That's why in our facility, what we are doing is separating the ICU and CCU from the rest of the hospital, so that once we start to get sick COVID patients, we isolate them and protect our staff, protect the patient, and protect everybody in the environment. So that's what we're doing right now to make sure everything is safe before we start to take on these patients. I fully expect these patients to come. I've studied the timelines. In all the countries except China, the people who got very sick, it started in this third week, about the third week, which is where we are. So I expect to see the ill patients coming around now in the next couple of weeks. And that's when we'll find out how far this thing is going in Nigeria. I can tell you that amongst the private hospitals, who do receive most of the patients anyway, like Dr. Aluko said, we take care of 70% of patients. We have not yet seen the surge of sick patients from COVID. So hopefully...
We could just interrupt you there. I wanted to switch gears and focus on testing. Actually, I want to put this question to the Health Commissioner, the Lagos State Health Commissioner, Professor Abayomi. If you could talk to us a bit more about testing. We also have a question on our social media channels from somebody called Mojisola Wilson, and she's asked you this question, Health Commissioner. She wants to know why the donations of medical equipment haven't... Well, perhaps, Dr. Yemi, if you could answer this question from Mojisola Wilson. She wants to know why there hasn't been widespread testing, why the medical professionals don't have the equipment they need. Could you shed some more light on that for us?
The question is on why there isn't widespread testing? I believe I heard that.
Yes, there are lapses. Exactly. There are questions that there have been lapses in testing and there isn't enough testing for a lot of people. There isn't widely accessible. Yet we are hearing that celebrities like Davido, for example, was able to secure more than 30 tests. If we were to put that example to Nigeria, why do you think there has been a lapse or a gap in testing equipment for Nigerians?
Well, the test for COVID-19 is still the benchmark molecular biology test. We call it the PCR. That test is only done in reference laboratories, and there are 5 reference laboratories in Nigeria. 3 of them are in Lagos. The test is very precise. Either the virus is there or it's not. So it's almost 100% accurate. It's very difficult to do at the moment. There's a lot of research going into finding out how to speed it up so that we can increase the turnaround time on the test and also increase the capacity to test. Right now, out of the 3 laboratories in Lagos, we are testing about 100, and that's going to triple in the next week. So by the end of next week, we should be able to test 300, and it's going to increase exponentially after that. The question I imagine a lot of people are asking is why we're not adopting the rapid tests, which are those kits that you can put a sample into and you can get a result very quickly. The problem with those rapid tests is that they haven't been validated. And you have to validate it you have to validate it in every environment that you use it. So even if it's been validated in China or in Europe, we still need to validate it in this environment because there are several confounding factors that apply to this environment that may not apply to China. We've seen some results or some publications that show that those tests, those rapid tests, can be quite inaccurate as 70%. In other words, if you test 10 people and your inaccuracy is 50%, it means 5 out of 10 times you're going to get a wrong result. That could have devastating implications for us. For example, if you tested somebody who was negative and you test them positive, if the patient was negative and you gave a positive result because of some environmental factor, you would then admit them into an isolation ward where there are other positive people. That negative patient would then turn positive. So invariably, you would have infected the patient because you had a false result. Similarly, if the patient is positive and you test and the test result shows negative, and you then say they're okay and they can go back into community, then they'll go back into community feeling like they're not infected with COVID-19, and they will spread the infection. So we're looking to validate these rapid tests so that we can make them more widely available. But we have to make sure that they're accurate with a very high precision level so that when we give a result, then we know we're actually giving the actual result. So far, the benchmark is still the molecular biology test that we do in these reference laboratories. And our strategy right now is to ramp up that capacity as fast as possible so that we're testing several hundred people a day in Lagos.
If we were to, again, circle back, I mentioned Davido and the fact that he says he was able to test himself and up to 30 members of his entourage. Can you offer any more information on how we are still facing a lack of proper tests? I appreciate what you've said about rapid testing. They're not as accurate, and you said that the proper tests take between 4 to 6 hours. But if we were to look at the Davido example, he does say that a huge number of his close and personal friends were able to access tests. How true is that, and why is he able to access so many tests, but yet still in Nigeria, here in Lagos, there is still a gap in testing?
Okay, so the federal government and the Lagos state government are offering testing free of charge. As I just explained, there's a limitation on what we can do because of the complexity of the testing. However, there are other institutions that have that capacity, and just like in Europe and America, they have decided to have a charge for their test. So they're charging a very small amount of money to have some degree of sustainability. That's a widely spread practice all over the world. And so if you are willing to pay for a test, then you can access some of these elaborate facilities or more sophisticated facilities and pay for the testing of coronavirus. That's not very widespread at the moment. And most of these laboratories are also beginning to offer this testing free. So I think that's how Davido was able to access a large number of tests of his entourage. But that's not the case in our reference facilities. It's free, it's triaged, it's based on case definition. If you fit certain criteria, and although that case definition is changing by the day because of the dynamics of the infection, but we are strictly testing based on case definition. If you don't fit that case definition, you will not be tested. A lot of people are asking for testing just because they just want to know. So we just tell them that we're not testing for peace of mind. We're testing for COVID-19. And if you meet the clinical case definition, then you will get a test in Lagos State.
Thank you so much for that, Professor Abayemi. Dr. Yemi Johnson, I'm going to come back to you. If a patient is to show up at a hospital, how do they know that they have the coronavirus?
Could you repeat the question?
If someone wants to show up at a hospital and they are perhaps exhibiting certain symptoms, how would they essentially know that they have the virus, COVID-19?
Well, that's a complicated question. What we do is assume everybody has COVID until proven otherwise. That's just to protect the staff. Now, when you come in, if you have the typical symptoms, cough, fever, shortness of breath, we assume you have COVID and we put you in isolation. Then we call the Lagos State and they come and test, and they have been responsive. So, but it does take time to get the results. That is the problem, and it's not peculiar to Nigeria. This is all over the world. It does take time. It's a complicated test. There's a backlog, and it's not very simple to do. So you've got to assume that that is COVID and treat as such until proven otherwise. That's the approach we have. And of course, you look for other things. You'll check to see if it's a bacterial infection and things like that. But generally, anybody who comes in with something that looks like it's an infection, you assume it's COVID for your own safety and the patient's safety and the family's safety. So you put the patient in isolation and treat as such. And I would encourage all private hospitals to set up some sort of isolation so they can keep the patient safe till a patient can be transferred to one of the state facilities. And I would like, Lagos, the government has been getting a lot of heat lately. But I like to say, I think what the job they have is rather difficult. And I think they're doing it very well. Today, I got 2 phone calls from friends and colleagues who were called because their flight that came in a week ago, 10 days ago, there was somebody who tested positive. And they both said they were called, explained, everything was explained to them, told them what to do, and they will be called twice a day. So I think we should give the state some encouragement and thank them for the job they're doing. It is a very difficult job.
Thank you, sir.
Thank you, sir. Well, if we were to, again, cross back to our state representative for health, Professor Akin Abayomi, I wanted to talk about the fact that we were at your presser earlier this week, and you talked about Nigeria, or Lagos specifically, in relation to other countries like Italy and Iran at the 4-week point, 4 weeks after the index case was confirmed. If we were to compare Lagos to those 2 countries, we can see that Lagos's number is dwarfed by the numbers in those other countries. And that, of course, when we put it into context, is because Lagos is a state and those are entire countries. But if we were to look at the smaller number of cases in Nigeria and in Lagos, is that because there isn't enough testing? Could there be a far greater number of people who are testing positive, but the issue is that we just don't know because they haven't been tested? Is that why the number is so low?
Long time. After Ebola in 2014, Lagos is an unusual city. It's a mega city, low-lying coastal city, hyper-density. We saw and experienced Ebola in 2014. We knew that with a combination of our medical endowment and a bit of luck, we were able to overcome Ebola, but it could have gone pear-shaped very, very, very easily. We learned a lot from that experience, and we were not prepared to go through a similar situation again in the future. We've been watching the global space and seeing that emerging infectious diseases or zoonotic events are increasing in nature, increasing in complexity. WHO talks about Agent X all the time. Well, Corona-19 is an Agent X, and we've been expecting the pandemic flu as well. So we know that our health system has some weaknesses. So when you know what your weaknesses are, then you defend yourself appropriately. We've been building a biosecurity capacity in Lagos for 5 years. We've got a very complex network of medical intelligence. We've built capacity. We've built biosafety facilities. We've been training personnel. We've been practicing simulations for the introduction of Agent X or any other pathogen of high consequence for several years now. We've been prepared, even 4 weeks before our index case, watching the global scenario. Mr. Governor initiated what we call the incident command structure. with him as the commander. And we started putting things in place, screening all flights coming into Lagos, making sure that we're watching the landscape, watching the dynamic of this global outbreak, changing our focus from country to country, and watching the inflow of air traffic from one part of the world to the other as the outbreak was moving across from Southeast Asia to the Mediterranean to Europe. We were also anticipating that many Nigerians were going to start coming back, so we started watching them as well. Our first index case, which was the Italian passenger who came in on the 27th of February, we were able to track all his 179 contacts very effectively, and we only managed to experience one transmission from that index case. And we tracked that transmission also, and at the end of that period, that virus introduction into Lagos was a dead end. It didn't result in any transmission into community. We're using the same strategy with all the other imported cases. And now, as I said earlier on, we're practicing social distancing. We're gaining a lot of experience from the patients that we're seeing on admission right now. We're learning and understanding how this virus is going to affect our population. We may change tack. It depends on how this thing evolves. But right now, our patient load is by far much less than what's being experienced in Europe and America. And I think that can be purely attributed to the very aggressive nature that Mr. Governor has put in place here. It's a strategy that's driven by the cabinet. Every member of the cabinet is involved. Mr. Governor is the incident commander. He's directly harmonizing the response strategy to the outbreak in Lagos State. And I think that if we carry on with this dimension, we may be able to drive the curve of the outbreak in the direction that we want, building capacity to absorb it, and simultaneously preparing for a surge as well.
Thank you so much, Professor Bami. Okay, we want to bring in Dr. Yele Aluko, Chief Medical Officer, America's Health Advisory at Ernst & Young. Dr. Aluko, I want to get your thoughts here. Has this been a wake-up call for the medical sector for Nigeria? That is to say, how do you think we're going to be prepared now for the next virus? We had SARS, we had the bird flu, H1N1 swine flu, the Zika virus, and so on, and now the corona. How prepared do you think we are for possibly the next virus? Has this been a suitable wake-up call, you think, for the medical sector in Nigeria?
Still out on that. I think that Nigeria has benefited from the Ebola experience, if there's any benefit from an experience like that, in that pandemic preparedness has begun. But it all also depends on how well the healthcare system and industry is resourced, because there is no healthcare system across the world that can really deal with the scope of this pandemic. The numbers that are described coming out of Nigeria are hopeful, surprisingly low. I am suspicious that the numbers may be a little bit underreported. If, for example, you look at a country like the United States, where you have 330 million people, and the projections are that about 40 to 70% of people will be infected. Not all of them will become significantly ill, but predictive modeling has already been done here and anticipates that about 100 to 150 million people will get very sick, of which about 500,000 will die. If the predictive modeling can be applied to Africa, and again, the problems that we're talking about in Nigeria are actually larger than Nigeria, because it's really the whole of Africa. If we apply the modeling to Africa, we're talking about a problem of overwhelming the entire healthcare system in pretty much all countries. There are some pockets of preparedness that are evident in Africa. The Global Health Security Index has classified Nigeria as one of the better performing, but not the best. But most of the countries in Africa, in fact, I think about 30 of all the African countries, are described as being poorly prepared to manage a healthcare security risk like a pandemic. So preparing for the future is going to be dependent on leadership that's coming from the federal government level, going to require leadership from the Ministry of Health, and to develop a system of communication that provides public health information that percolates down to all the people on the street. That requires very deliberate strategy. This is strategic planning and resourcing all the stakeholders that are involved in executing on the strategy. Absent of that, if that is not done, irrespective of whether it's in Nigeria, Africa, or anywhere else in the world, that country will not be well prepared for another type of pandemic like this.
If we were to bring in Dr. Abiodun Aluko, do you agree with what Dr. Yele said there? Do you agree that there isn't enough preparedness?
I dare not disagree. I dare not disagree, to be honest. But I agree with him, actually, in a way, that the preparedness is obviously there. I was here in Nigeria at the time when we had the Ebola epidemic. And it's sort of, like we have all said, it sort of sensitized us to hand washing, sanitizing, and being constantly in a state of awareness. So as far as that is concerned, the people are primed. Now, the healthcare, the public health service is also actually primed. They're actually doing as best that they can, and they're doing things that you know that they have experienced before and they've built on their experience. The challenges that we have, that I've been speaking about, have to do with healthcare delivery. It's not exactly the public health policies. Now, the healthcare delivery is done, like I said, primarily by the private sector. What has been lacking, or what I feel that we haven't received, is the support or the information or the tutoring or the partnership with the healthcare, with the public health, so that we can work together in the same path towards achieving the same goals. Now, my dear friend, Dr. Johnson, says he treats every patient that comes into his office as if the person potentially has in fact, coronavirus, okay? Now, Dr. Johnson is tertiary care and primary care, okay? Primary care, we see everybody who walks in. Most people walk in with simple things. Sometimes it turns out that there's a travel history that was missed at the screening. A lot of times our doctors feel that they have been misled. But whatever the case is, we find that we're in front of a patient who is presenting themselves as a risk. Now, it is not easy, neither is it economically feasible to be totally kitted in PPEs from morning till night, shift after shift, for every single staff. So it presents an economic challenge for us. It also presents a challenge in terms of taking care of ourselves. So as far as that is concerned, I agree, and I really do agree that Lagos State has done a great job. I think that HEFEMA, who is the state agency that actually looks after all of us, the private health cares, I think we should be interacting a lot more so that they try to make sure that we get the things that we do need so that we can all achieve these goals. We're talking about social distancing now, we're talking about case isolation, we've been talking about quarantining and contact tracing and all of those things. And I believe that if we had far more information and we're working under the supervision of HEFEMA, for instance. HEFEMA, for instance, can get PPE for the private. We're registered and we actually pay an annual dues. So we can get PPE and we can actually get it from them at cost or something. It doesn't have to be free, but there's a way that they can assist us so that we are not putting everybody at risk. Certainly, some of us have decided to do telemedicine. Some of us have decided to shut down our practices for now. So maybe we'll be able to offer the Lagos State excess capacity. We might be able to do that if that becomes necessary. So those are things that we are finding out on our own. My biggest thing is that it is our problem, all of us. Every single member of the healthcare delivery chain is involved. And I think we need to be working together and each person discussing all our differences and our difficulties so that we can reach the goals. We certainly do not want this to spread, because the truth of the matter is that those of us that are in healthcare delivery, actually know that if we get the numbers that are seriously ill that we can possibly get in a worst case scenario, our healthcare system will collapse. So it is very, very vital that we work as hard as we can to avoid that. And all hands need to be on deck. There's a population I want to talk about. These population are the ones that I see, and I have a little bit of difficulty deciding what to do with them. These are patients who have traveled. These are patients who maybe they don't have a fever, but they have a cough. So by definition, because the NCDC gave us a protocol, by definition, these patients are supposed to be tested. I understand the challenges with testing, but these are patients that we're supposed to keep in isolation, and somebody will come and test them where they are. Now, because of the challenges with testing, the numbers and so, we have these people who don't get tested. A lot of times they get fed up because they're not critically ill. They just came because they have a bit of a cough. And they go back to their homes. And they kind of, to me, I feel as if that population of not critically ill, untested, possibly carrying the virus, I feel as if that population should be held somewhere. I feel as if them being held in their houses, they're going to banks, they get bored of being in isolation when they're not so ill, so they're going to places when they could have gotten tested and then they could have known exactly what to do next. That is the population that actually worries me, because the people that are most, or a population that actually transmits the virus is one that is potentially not very ill and actually, in fact, sometimes asymptomatic. So so that population actually worries me, because they are the ones that they get impatient. They didn't come to test us, so they go and they kind of feel I'm well. But it's not about you being well. It's about you being potentially infectious. So that is something that I'm hoping that my we will talk about.
Indeed. Well, if we were to just hold on there with our medical professionals here in Lagos, that is Professor Akin Abayomi and Doctors Oluko and Dr. Yemi and also Dr. Yele over in the States. We wanted to kick it back now to Professor Sean Griffiths and also to Alex. Sean, I was watching your reactions to the Nigerian medical professionals talking there. I saw you nodding your head a lot of the time. Could you discuss or highlight anything that stood out particular when you were listening to the Nigerian healthcare professionals there?
Yes, I think listening to the whole issue of what do we do about, how do we deal with the people who aren't feeling very ill but could possibly have the infection? The strategy that's been adopted in the UK is for people to stay at home and to be, we now have a system whereby if you think you have the condition and you're not seriously ill, you stay at home for a week. You are often in contact with your general practitioner, but you stay at home for a week. Your family also self-isolate around you. So if you have the symptoms, it's 7 days. Your family, it's 2 weeks. And I think people are actually understanding why you do that and are sticking to that. But it is a difficulty, this thing of, you have to grow a consciousness, really, so that people do understand that they need to stay at home and to isolate and to take self-isolation seriously. I think in other places, such as Hong Kong, the self-isolation at home is being used more and more rather than just in facilities, because the volume of people that this affects is so large that you can't actually put people in institutions anymore. Very early on in the epidemic, we saw it was pretty similar system. We had very few cases. If you had a case, you went into isolation in a hospital ward. That soon became impractical as the number of cases got too big. You had to institute a system whereby people who were not that unwell stayed at home and were monitored at home. So I was feeling for the doctor who was describing that. I think many of the issues sound very similar. The issue of PPE, the issue of testing, the issue of availability of testing and the need to ration testing so that it's for the priority, it's for those that are sick, to protect the healthcare workers in the first instance. All of these are lessons that we can share between different countries as we all go through this disease, as it takes a grip. And now in the UK, as I said earlier, we don't actually know how many people have it because we haven't had that widespread testing that you might have had in Korea. But we do know the numbers of deaths, and the numbers of deaths have been going up, and we look at the modelling. So we're further along the curve. Every country may have a different trajectory, and the steps that are taken by different countries will alter that trajectory. And it sounds as if that Nigeria is well prepared, and this has been thought through very well. So hopefully we talk about, in the UK, we use the science to flatten the curve. We're talking about doing these social distancing measures now for the whole population to flatten the curve, to decrease the surge in the healthcare sector, to try to get the best outcome for the population. And it sounds as if Nigeria's approach is very similar. So I think there are many similarities, which is really why this is a global problem. This is a global issue where we really need to share the lessons and share the learning as we go along. Because every day we see new papers being published in the journals, we hear of new understandings coming both from sort of Wuhan, from Italy, and from other countries. So this is a global issue with lots to share and learn.
So much, Professor Griffiths. I want to go over now to Helen Robinson-Gordon, who is the head of news and media at the British Medical Association. Helen, can you speak about the importance of effective communication during a pandemic, I guess from the public and private sector to citizens, the citizenry?
Helen, you're muted.
Apologies, I think you couldn't hear me. I think what's really important is that we have very clear and concise messaging both for the general public and for healthcare workers. There has to be a level of messaging that the public believe, and they have to understand why they've been asked to do what they are going to do. And I think particularly in the UK, we have seen, unfortunately, a lack of trust and a lack of belief and an inability by the government to control the messaging. I think for us here in the UK, that's caused quite a lot of issues, and I hope that's something that Nigeria and other countries can learn from us. So as well as you can learn from what the good things that we've done, you can also learn from perhaps some of our mistakes where we haven't maintained control of the messaging.
Well, Helen, before we let you go there have been some questions on social media, especially pertaining to the United Kingdom and the NHS. There are lots of people who want to know about how well NHS doctors on the front line are being protected. We have been hearing from doctors themselves on social media who have said that they are treating patients or are definitely in hospitals and haven't been offered tests or haven't got access to tests. What do you have to say about that?
That's something that not just the British Medical Association has pushed for, but has been pushed for more widely. We know that doctors on the front line have not either got any PPE as yet, or if they have got it, it's not been adequate. And we've had this problem now for probably the last 2 or 3 weeks. We are knowing from the British Medical Association represents just short of 200,000 doctors in the UK, and we know from many of those that they have not got access to the personal protection equipment, the PPE as it's called, that they need. So that's the gowns, the masks, the gloves. And the government tells us that it is being shipped out, that it is being moved into those frontline doctors, into those frontline hospitals, but we know that many are not seeing it yet. And that is a really big worry, because not only are they not able to protect themselves adequately, it means they're not able to protect their patients. So it means they're going from patient to patient, potentially taking the COVID-19 virus with them. And that's a really big concern for us here in the UK. And it's a #1 concern, I think, for most of our frontline medics, is please give us the protection that we need so that we can look after ourselves, but more importantly, we can look after our patients.
If you could be a bit more specific and highlight the top 3 things in terms of equipment that these medical professionals are in desperate need of, what is it specifically that they need?
I think it's not quite that simple because the requirements are different in different medical scenarios. So what a general practitioner, a GP, a primary care practitioner will need is perhaps a little bit different from what a hospital doctor would need. Having said that, there is actually now a very broad brush swell, if you like, swell of opinion or of thinking that actually all doctors need the same level of protection. And what primarily they're calling for are proper full-fitting face masks, what we call FFP3s. These are masks that are fit tested and have to fit closely to the face. There are gowns to cover the clothing, and there are also gloves. And visors, face visors, because although the mask covers your nose and your mouth, it doesn't cover your eyes. So it's visors, masks, gowns and gloves.
Thank you so much, Helen. Our next question is for Dr. Yele Aluko. Dr. Aluko, I want to read a tweet to you from the Federal Ministry of Health saying that Nigeria now has 6 functional laboratories that is going to be used to test for COVID-19, the latest being in the University College Hospital in Ibadan. Is that a satisfactory number to you? And what number would you think we would need to be in? Is it double, triple digits as far as testing is concerned?
That's a great question. So we have to understand the resources that we're dealing with. And if the government is going to regulate the testing, and there are good reasons to do that, the obvious reason to do that is to ensure that, as Professor Barney said earlier, that you don't get false positives and false negative tests. So, but there is an opportunity, depending on the resources and the partnerships that the Nigerian CDC has with industry. For example, in the Western world, there are partnerships that have been developed with commercial labs that are able to also replicate the capabilities and scale them to a point whereby many more people can get tested. 5 is a small number for the size of the country, and understanding the logistics that in only two cities, Abuja and Lagos, you're going to have to be transporting specimens across geographic boundaries, and logistics will delay results. If, however, that is what our resources support, we've gone from 5 to 6, that's an improvement. I would hope and I would imagine that the private sector can step in and have a dialogue with the power be in government and the ministries of health as to how they could to increase its capabilities for testing.
Thank you, Dr. Yele. If we could go back to Helen over there in London for us. We know that it's no secret that some high-profile people in the United Kingdom tested positive for COVID-19, them being Prince Charles and, of course, UK Prime Minister Boris Johnson. These naturally garnered a lot of attention because of the high-profile names attached to them. But if we were to look at the spread of COVID-19 in the United Kingdom, how much worse do you think it's going to get?
I'm not a medical expert, I'm not an epidemiologist, so it would be unfair. This is just my opinion, listening to the doctors that I work with on a daily basis. We know that the UK hasn't hit its peak yet. We are told by the government, we're told by doctors and specialists that we're looking at another 2 weeks, week to 2 weeks before we hit our peak. But we do hope that the work that we're doing now and the social distancing, they're asking people to continually wash their hands, not to go out unless it's really necessary, and to self-isolate is going to help us flatten that peak. But we think we've got about another week to 2 weeks before we hit it yet.
So much, Helen. Professor Griffith, I want to come back to you. You spent a considerable time in Hong Kong. I want to talk about something that was in the news recently about Hong Kong being afraid of a second wave. Okay, we're going to take a break. We'll take a quick break, and Dr. Griffith, Professor Griffith will be back with you in a moment as we take this quick break. We'll be back with you in a moment. You're welcome back to Arise News. You're watching our special global briefing on COVID-19. I want to take it back to our international panel. Professor Griffith, really quickly, before we went to break, I wanted to get your thoughts on the fear of a second wave. We're talking about your time you spent in Hong Kong. They're a little worried about the possibility of a second wave. I think China as well. I wanted to quickly get your thoughts on the possibility, your fear or worry about a second wave hitting some of these Asian countries.
It's not just my fear, I'm afraid. I'm afraid there is a second wave in Hong Kong, and that's due to imported cases. Hong Kong dealt with its initial phase with quite quickly taking quite a lot of lockdown-type moves because it's been sensitized by SARS, and it's a very unique environment, the city-state of Hong Kong, very high-density population, and certain moves were taken, and that controlled the first wave. It came to the end of term, big movement back of many international students back into the very small space of Hong Kong, and they've seen an increased number of cases, mainly imported cases, many of them in the younger population, and so they're moving to more social distancing and closing bars and restaurants and putting into place many other strategies that other countries have actually already adopted. And the same in mainland China, very worried about the importation of infected cases. And there they put in a lot of travel restrictions, particularly people from other countries who have to go into quarantine as they go into China to really stop the spread of the disease any further.
Oh, thank you very much Professor Griffiths. If we were to switch gears now, we know that within the last hour, Nigeria's President Muhammadu Buhari has addressed the nation on the crisis and his latest measures to deal with it by declaring a curfew in Lagos, Abuja and Ogun State. Well, Arise News' anchor, Charles Anyogolu, was listening to President Buhari's speech, and he joins us from Abuja for his analysis. Thank you very much for joining us, Charles. What are your thoughts?
Femi, thank you very much indeed, and hello there to our audience. Well, I think for anyone who had any doubts about the seriousness of this outbreak in Nigeria, President Buhari's address would have brought it home as perhaps never before. I mean, his aides would say he came through as many hoped he would. President Buhari, of course, imposing sweeping restrictions, not across the entire country, but in the hotspots of Lagos, Ogun State, which is across the border from Lagos, and of course the Nigerian capital, Abuja, where there have been a number of confirmed cases of the virus. He reiterated a lot of the advice already out there: social distancing, hygiene practices, wash your hands, etc. He talked about what the Nigerian Centers for Disease Control and the Ministry of Health are doing to minimize the impact of the outbreak. Then he also talked about what he called the two-step approach, which is broadly to preserve life and to protect jobs and the economy. In terms of the strength and power of his speech and delivery, I'd say that he started rather weakly at first, but I have to say that as it progressed, the pace picked up in strength and style, and it became generally quite a positive, quite a compassionate pep talk, in effect saying that we're all in this together. So I think there'll be a feeling, I think, that the president is finally stepping up to the plate and taking charge. Importantly, he said all confirmed cases are getting the necessary care. That's obviously important because Nigerians are worried about whether their health care is adequate or will implode with a little pressure. So far, so good. And of course, as I mentioned, he imposed a lockdown on Abuja, Lagos and Ogun State from this Monday for 2 weeks. He said the containment period will be used to identify, test, confirm and treat coronavirus patients. There are exemptions. I think you mentioned that earlier. They include hospitals, food processing, distribution and retail companies, security firms, petroleum distribution and retail firms, companies in power generation, transmission and distribution, broadcasters, electronic and print media, telecoms companies, obviously police, army, as well as seaports. He said that movement, and this is quite important, of all passenger aircraft is also suspended. This is, of course, a war of sorts, but it is a war in which some Nigerian civilians are going to be caught up in this war without any kind of shield or armor or protection. People, particularly in the informal sector, in the urban slums, in rural villages and towns, in the internally displaced persons camps, where many people don't even have water to wash their hands. Well, the president said the conditional cash transfer program, which is supposed to reduce poverty by paying cash to the poorest and those most in need, will be speeded up. The government was also going to deploy relief materials to ease the pains of those living in the more deprived communities in the coming weeks, though obviously I would imagine that those people need that relief now, given that the lockdown is imminent, rather than a few weeks from now. So broadly speaking, I think in terms of immediate reaction, that's obviously still trickling in because he spoke just over an hour ago, but Nigerians in Abuja and Lagos were already self-isolating to a large extent, so this will not be too much of a surprise, though of course the fact that it is now going to be enforced clearly takes it to another rather more difficult level. Now back to you in the studio in Lagos.
Thank you so much, Charles. Well, before we go any further, I hope that Professor Akin Abayomi is still with us, because we've been having a flurry of questions on social media directed to him. Professor Abayomi, are you still there with us?
Yes, I'm here.
Well, we've got a few questions on social media. The first is from Mojisola Wilson, and she says that Nigeria has received a shipment of 250,000 boxes of supplies donated weeks ago, and she says that not a single hospital has received any. She's asking when Nigeria will get PPE. How accurate is the information in her question, and do you have an answer for it?
So yes, I know that we received a donation from Jack Ma, and we are receiving donations from other philanthropists and other well-wishing countries. The federal government is receiving these donations, as well as the Lagos state government, and we're distributing them according to need. And there's still lots of personal protection equipment in the market which we are able to purchase. If we get a very large surge in the country, of course there will be demand on these kinds of disposables. But I think the other countries that have survived this outbreak, and there's reduced burden on those countries, I'm sure in the interest of global harmony, that countries will reach out to one another and help them in their difficult periods of this outbreak that's moving around the globe.
Abayomi, there's also another question on social media, also for you. It's from Oguguwa Osiogbu. He asks that social distancing and hand hygiene, the using of soap and water and plus or minus hand sanitizers is a luxury in certain communities, especially the rural parts of Nigeria, and of course for people who are in internally displaced camps. What are your thoughts on how we deal with extending access to basic hygiene utensils for those people?
Well, I think, access to good sanitation and access to potable water is still a national challenge. We need to take water from different sources, from the ground, from wells, from boreholes, from rivers, from distribution, from dams. And I think, by and large, the country is ramping up its capacity to deliver potable water to as many people as possible. I think this outbreak shows us that we need to spend more capital on these projects to ensure that access to clean water, access to safe water, especially to our schools and our parts of our megacities that are experiencing hyper-dense population, is a priority. So we've known that in Lagos for a long time, and the emphasis of this government has been on health, has been on education, and has been on environmental issues, increasing the access to good sanitation, sewage and clean water, revamping our schools and revamping our hospitals to try and strengthen our healthcare systems and build our resilience and decrease our vulnerability to these kinds of scenarios. So as I said before, we've learned a lot from the outbreaks that we've experienced. Lagos is quite experienced in these scenarios. We're not taking anything for granted. The governor is very aggressive with his strategy to build capacity to ensure that we can at least hold back these kinds of situations for as long as possible and save a surge and an overburdening and a crushing admission of cases in our healthcare systems.
Abayomi, you are a very popular man this evening. We've got another question. This one is from Bimbo Ogunbanjo, who is the president of a stock exchange. Bimbo asked, she wants you to answer what the top 3 resources that are needed for the fight against COVID-19 in Nigeria. If you could identify the top 3 resources that are needed.
Yeah, the biggest resource now is awareness. You know, we must teach and repeat and teach. You know, not everybody understands corona. Corona and biosecurity are complex phenomenons. You know, even amongst us as professionals, biosecurity and biosafety and surge countermeasures are not easily understood strategies. You know, so I think even for the layperson and for the people in rural communities, we must put that message out there in the language that they understand and teach them in concepts and put it out in different languages and different dialects so that we're educating the population. We must emphasize this social distancing in every form and format and language that we can possibly do that. The second thing is, you know, we're watching this dynamic very, very carefully. We're trying to plan way ahead of it. We're trying to think of strategies. We're thinking of various scenarios. If we get overwhelmed by this outbreak, then we might, you know, change our tack. We're learning a lot of experience from the cases that we're seeing right now. If we get overwhelmed, if our hospitals cannot cope with the sick or with the positive cases, then we might change our strategy so that we're managing people in community, and we'll then deploy medical personnel to people's homes and reserve our facilities that we're building right now for the very sick. And then we'll build more capacity for high care amongst these facilities. I think that by and large, we can't tell which way this thing is going. Everyone talks about flattening the curve. All that really means is we're trying to interrupt the transmission of this virus so that we're buying time to build capacity and to think of strategies that we can use to overcome this outbreak.
Thank you so much, Professor Abayomi. We're going to go over to cross over to our Abuja studios now, where Charles Anyago is with the Minister of Health. Charles?
Thank you very much indeed, Rotus. I'm Charles Anyagolu here in Abuja, and we are, of course, part of this Arise News special global briefing on COVID-19, and I'm delighted to say that I'm joined in the studio in Abuja now by the Nigerian Minister of Health, Osage Hanire. Thank you very much indeed for coming in. We absolutely appreciate your being here. You've been very busy at the front line of this fight, so we appreciate your taking the time. But it is fair to say that informing the public is as much as important as fighting the disease itself.
You are correct. Informing the citizens is as important as fighting the disease. You are fighting ignorance and misinformation on the one hand, on the other hand, fighting the virus.
And how worried are you by the speed and the extent of the coronavirus outbreak in Nigeria? I mean, it seems to be growing exponentially and explosively.
Yes, it is growing exponentially. That is the nature of the disease. It grows exponentially. But compared to other cities, other countries, we have done fairly well. This is not to say that we are going to rest on our oars at all. We could do much better than we have done. The opportunities are there to improve on what we have been doing so far. The increase in the last few days or weeks is due to the large influx that came in from outside the country over a period of time. For the few days we had just one case, we were able to trace 179 contacts, of which we found one person who was infected, and both were treated, and both are well, both were discharged. And thereafter, a large incidents occurred where many people coming into the country complicated the picture for contact tracing.
And beyond those people who are the obvious ones who are coming into the country, as you said, through the airports and so on, should we be particularly concerned about so-called shadow zones? I mean, areas which cannot be reached and where patients are not being detected?
Well, they're not patients until they're sick. Before then, they are just citizens.
Yeah, but you don't know if they're sick or not.
Yes, until you test them. And when you test them, they are positive, then they become patients. But before then, they are just people who you are looking at as contacts. They have to be contact of someone who brought in the virus from somewhere outside the country. So the contacts of those persons are the ones you are looking for, who you want to put in isolation first and foremost, who you want to observe over a period of the incubation of 14 days, and if they are positive, to now put them into treatment centers.
But is there concern that there are shadow zones?
Yes, there are shadow zones. There are persons who might not know that they have been in close contact with a person who was positive. There are persons who become positive when they think they have not been in contact with someone who traveled. So those are the areas you might like to call shadow zones.
And those are areas that are a big concern to you, obviously.
They're a big concern to everybody who's concerned with handling this disease program.
And this may not be the fairest question in the world, but how long do you think combating this disease is going to take? I mean, we're seeing the Americans trying to put a sort of a rough date on it, the British and so on. I mean, because it's not getting better, it's getting worse, isn't it?
Yes, it is getting worse in some countries, and I think before it got better in other countries, it was worse. China and South Korea have announced relative successes, but before that, it did get pretty bad for them. But it's a mixture of many things, very many factors indeed. Part of it will be, let us say, pure luck of how many incident cases you got, index cases you got, and also the style and the strategy with which you managed. We want to pursue very aggressive contact tracing and being able to identify those who might be at risk. We believe that if we do that, we reduce the possible load of patients and reduce the problems we have to deal with. If your health system is not strong, you better be quick.
What would you say are the biggest challenges that you and your team face in dealing with this pandemic?
Well, the first is the one you just mentioned, the gray areas, the shadow zones, the ones you do not know, who pop up here and there, and those who now lead you to what you call community transmission. But the earlier you take care of the case, the earlier you identify the contacts, the earlier, in fact, you do identify the index, the better for you. And that is why we have all those. We had all those who came into the country fill in forms and call a number if they are not feeling well, go into self-isolation. So it gives you the opportunity to catch as many as possible of those who may have brought the disease into the country, and then their contacts, as many as possible. It might not be 100%, but the more you can get out and put into isolation, the fewer there are who threaten society.
Now, we heard the president earlier today putting part of the country on lockdown, Lagos, Abuja and Ogun State. Do you envisage putting the whole country under total emergency anytime soon?
That is not ruled out. It depends on how well we utilize this window of opportunity. I was fortunate to have been able to join the teleconference of governors today, and I also tried to make this point clear that in each case, in each state where we are looking for contacts of those who somehow were seeded into other states from Lagos and Abuja, those are the international entry points, they need to diligently pursue case finding, identify the individuals, their contacts, and put them into isolation. Even if you are going to rent hotels, rent halls, and make sure that those are identified and tested And if you are able to do that successfully, you take care of your citizens in your own state. And that should help the whole country.
I mean, obviously, you brought in, the president announced earlier, the stricter measures that are coming into as this crisis deepens. The question on a lot of other people's minds is, how are these going to be enforced? Are you going to have police officers in every neighborhood in Abuja and Lagos monitoring that what people are doing in their own homes?
Well, in many countries, you see that law enforcement had to be brought in. Very many countries. I did not mention the countries right now, in order to enforce government policy. But the first thing you want to do is to appeal to common sense, and that's what we have been trying to do. Also to inform the public, which is what we do at every opportunity, and make it clear that whatever you do, whatever sacrifice you make at this time, is for your own good, the good of your own family, your community, and your country. And we hope that that works. If it does not work, then other measures come in. We also appeal to those who have influence over the communities, the gatekeepers, the religious leaders, community leaders, even political leaders, to impress it upon the people that they need to comply with the advisories.
Obviously, what you're dealing with is a critical issue of public health safety, and clearly important for Nigerians to adhere to your directives. What sense do you get of how people have been reacting to those directives and the directives of the government? Because, I mean, the closure of schools, for instance, means parents will be forced to stay at home because their children aren't allowed to go to school.
Yes, that is true. The other side is that some parents will take their children with them to work or to the market or wherever it is that they carry out day-to-day business, which is not the best. But then again, the stay-at-home order now should be able to impact on all families, that you should go to your house, not only closing schools, but closing offices. Makes it mandatory that people spend more time indoors and not necessarily expose themselves to the risk of infection by circulating outside and going to large gatherings and congregations where you might find yourself next to a person who might indeed be positive and not know it.
And not to sort of over-dramatize the language, to use military language and to borrow the words of the South African Minister of Health, it seems like Nigeria is being turned into an area of hard combat. In other words, there are certain sections of this country which will now be faced with that situation, which basically means that everyone has to turn themselves into a sort of soldier and take responsibility for fighting this infection. I mean, is that a good way to put it, or is that too strong?
No, it's not too strong. That's a good way to put it. We are fighting an invisible enemy, and this enemy, as we can see on television screens, has done a lot of havoc in other countries. We will be happy not to have that repeated here. Therefore, all measures that need to be taken to avert those scenarios need to be taken. Yes, hard situations demand hard answers and hard responses.
Now, I may be a little bit out of touch here, but a couple of weeks ago, resident doctors in Abuja, who make up a significant percentage of doctors in the capital, up to 80% in fact, went on strike because they hadn't got paid. What's the situation with that?
Well, I do not exactly know what the situation is, because the Federal Capital Territory doctors are not directly under the Federal Ministry of Health. They are under the Capital Territory Secretary for Health.
But I would imagine that's of grave concern to you.
Of course, it's of grave concern to us. I have, in fact, addressed that topic, and I have said that it is a wrong time to want to embark on any industrial action. It is unethical when you know that your community is facing distress to want to withdraw service. That is not acceptable. And I've advised that they choose another moment to make their claims known and address themselves to the work at hand and challenges at hand at this time.
Well, I mean, I have to ask what the reason is for not paying them. And I know you said you're not directly involved, but I expect that's something that's of concern to you. I mean, is it that the government doesn't want to pay them or can't afford to pay? Because if you don't have the money or the will to pay those in the front line of fighting COVID-19, how are you going to battle the pandemic?
Well, that's a good question, a fair question, but the doctors, as I say, are under the purview of the Federal Capital Territory. The federal government is paying its staff, but we know that some of the claims that are being made are very many years old. There are some claims for some allowances that are probably several years old. There are others that are contested, where the employer and the employee are not on the same page as to what is due, one or the other. There are some that have to do with the question of no work, no pay. If you are on strike, you don't get paid. And some who have been on strike want to get paid. That creates a matter of difference in opinion. What exactly it is in the Federal Capital Territory, I do not know, because they do not report to me. But in the federal level, we've seen that. We've tried to be reasonable, to discuss with the unions, and they have been very fair and considerate, I must say, to their credit, at the federal level.
Okay, well, let's move on to things that deal directly with the COVID-19 and the fears that people have. What about testing? Are enough people being tested for this disease? Are there enough beds? How about ventilators? I mean, how about chloroquine? And I know there are quite a number of questions bottled into one, but I think they've got a similar theme running through them.
Yes, there is no country that has enough of any of these. Every country has been more or less caught off guard as to the extent and the volume of the problem that has faced them. And the different countries are scrambling to meet up with the needs that are propped up. You know that one country ordered their auto manufacturing company to start producing ventilators. And various countries are also ordering different companies to start producing this or that, which means they also didn't have enough. No country has enough. We also know quite clearly that we have limitations in all of these commodities and equipment.
Which is why you're taking these measures now,
Very
so it doesn't
good,
get
yes.
as bad as...
Our motto is strive for the best scenario, prepare for the worst scenario. So we are doing both. We are preparing for the worst scenario. We are working with the private sector to find out how many ventilators they have, and if they can bring this out in case they are needed, and also to conduct an audit to know how many we have, and also the possibility of who can work in the treatment of coronavirus. So a lot of collaboration between the public and private sector, and among various arms of government.
And, I mean, concern obviously has been expressed about the lack of facilities in many hospitals. I mean, we're not just talking about Abuja, Lagos, and, you know, some of the more sort of progressive parts of the country. I mean, you've got, you know, rural areas and stuff. I mean, some have said that a lot of these hospitals don't even have crucial things like water or enough sort of sanitizers and masks to cope with an outbreak.
Well, that's why I told you, if you are not strong, you better be fast. And one of the reasons why we are very, very aggressive in testing and contact tracing is to try to make sure that hardly any gets to rural areas, and if they go there, that we get them in time, because we know the weaknesses in those areas, even the weaknesses in the cities. We know the strength and weaknesses of our health system, and we have adjusted our strategy to be able to take consideration of those weaknesses while we try to plug the gaps that we have. But again, let me say that every country has faced these challenges. We have seen some of the Western European countries where patients are lying on the floor. I've seen where they are overwhelmed. They don't have enough bed spaces, where they are building new tents, converting churches and...
Right, but do we know how many beds we've actually got in Nigeria for this disease?
We have mobilized a large number of beds. We have mobilized some hotels, as far as Abuja is concerned, and Lagos is doing the same thing. They have opened a hospital tent. Right now, we are being offered a hospital tent here too. And we have a large number of beds available as I speak to you. We have over 1,000 that are empty and free right now.
Right.
So those ones are, and then again to say that the coronavirus indeed has a mild form, and a moderate form, which do not really require very sophisticated treatment.
But they require isolation.
They require isolation, correct, and also just treatment, supportive
Right.
treatment.
Okay, and how many tests have you actually conducted in Nigeria?
Well, we have conducted over 1,000 tests, if I can count them properly, and we are doing targeted testing. We're not just testing blanket. So if anybody meets the case definition for probability of having a virus, we invite them for a test, and those are the ones who have just come in from abroad, particularly from high-burden countries, and persons who have been in close contact with any such returnee to the country.
Minister of Health, Nigerian Minister of Health, Osagie Ohanire, I want to thank you very much indeed for coming in. You're in the front line of this fight, so stay safe. Thank you very much.
Thank you. Thank you for the opportunity to speak to the public.
Now back to you in Lagos.
Thank you, Charles.
Thank you so much, Charles. Thank you to Charles, and thank you, of course, to our Minister of Health as well. We're now going to take it back to our panel here in Lagos. And Dr. Yemi Johnson, I would like to ask you, Dr. Johnson, if you could react to what you've heard from the Minister of Health there.
Over there. Yes, thank you. Well, the minister covered a lot of topics, so I wonder what particular point you want me to discuss or rebut on.
I guess the beds, the issue of the number of beds that we have in that regard.
Well, now there are two types of beds. There's the isolation center beds, which is for people who are mildly ill. So right now we have enough for now. It is likely we have to up capacity if the numbers grow. Then there's the hospital beds for people who are sick, who are very sick, critically ill. That's where we're going to have some trouble. That's where our hospital capacity is going to be stretched. We are already stretched. Most government hospitals are full already with sick people. Private hospitals, we've almost ground to a halt because of the virus. Everybody's scared of taking on patients. So private hospitals have some capacity, that is bed-wise, but they have not been supplied with a lot of the equipment that is required. So that is where we might run into some difficulties as well. But as far as beds, that's the way I see the bed situation. And I can speak for Lagos State, since I am in Lagos. The IDH hospital or isolation center is not yet full. Then there are the new ones being set up by GTB, and there's another one set up, a hospital being set up. So those are all places that have not yet been used. So we do have some of that capacity. But I do have some hopeful information. I found out from the commissioner that the age group of patients is between 19 and 50, which is what I expected. Nigeria has a relatively young population compared to countries like Italy and Japan. So, and as we know, the disease hits the older people a lot harder than it does the younger people. That doesn't mean younger people are completely immune, but they tend to have less complications. And mortality amongst the young is a lot lower. So we do have a young population, and so far it's the young people who have been affected. Now when the secondary cases start, they might start to give it to their parents or their grandparents, and that's where we're going to run into trouble. And that's probably why we haven't seen the surge of critically ill patients in Lagos.
Okay, Dr. Yemi Johnson, just one more follow-up with the surge now. Does that make this 2-week lockdown crucial? That is in Lagos, Abuja, and Ogun State. Should Nigerians have some sort of expectation that after these 2 weeks, there will be a handle on the number of expected more infections that we're supposed to see? Should there be some type of expectation that this 2-week break is supposed to allow the medical authorities to be able to clamp down on that?
Well, in this business, there's nothing that's for certain. It is the hope. Now, if you are able to, clamp it down, keep it in the epicenters, that's logistically easier to deal with, rather than when it's spread all over the country. Then you've got to start sending people all over the place. Outside Lagos, Abuja, the healthcare system is a lot more fragmented and less able to deal with this kind of problem. So it's best we try and keep it in the epicenters. And the 2-week break, I think, is critical. It is crucial. And the good thing is, I believe at least most people in Lagos are aware and are trying to do their best to observe social distancing. Now, it's difficult in the face me, I face you communities, but I can tell you most people are very aware and they're trying to behave accordingly.
Thank you so much, Dr. Johnson. Thank you.
Thank you so much, Dr. Johnson. Well, we are going now to over to London, and we want to speak here. If we could just take a second now to switch gears. We thank Dr. Yemi Johnson for his time now. Not since the Second World War has the world experienced the kind of economic chaos that we are currently witnessing now with the outbreak of COVID-19. Naturally, this has had a knock-on effect on the economies of the countries that have been affected, and definitely a knock-on effect on the global economy at large. To discuss this further, we are joined by our business correspondent, Laurie Laird, who joins us from the London office. Laurie, thank you so much for your time. What are your thoughts on the global economy here?
Oh, okay, so we're still waiting on Laurie, yes?
Uh-huh.
All right, so while we're still waiting on Laurie, as far as the global economy is concerned, so we've seen a number of hits across. Okay, you and I have talked several times about, for example, the aviation industry, yeah? Absolutely. The aviation industry is expected to take a hit of $150 billion this year, right? And with regards to...
That's the global aviation
industry. So we've seen, you and I, we've talked about Qantas in Australia. We've talked about Fly By Me in the UK that's closed.
Going bust.
They've closed down. So the ripple effect, we've seen that ripple effect across the aviation sector. And it's led to a huge number of job losses. Just this last week of March, there was the United States unemployment figures, right? With regards to unemployment filings, the number of people who have jobless filings.
Who have claimed for
jobless claims, yeah, jobless claims. 3.3 million. I mean, that was a record, right? I think the last record before then was about 695,000. So that just tells you exactly how badly hit the U.S. economy, which is the top economy in the world, has been hit.
And that's going to have knock-on effects for the rest of the countries. We heard Alex at the very beginning of the show talk about the fact that naturally the US dollar is the world's trading currency, and there is already a huge issue with the liquidity of dollars because the dollar has naturally strengthened against a basket of currencies, which means that many countries are going to struggle to repay their loans. So again, the fact that the US is definitely is sneezing, the rest of the world
is catching a cold.
Catching a cold,
and even beyond that, this of course affected China to start with. Back in 2003, when the SARS epidemic happened, China was only responsible for 4% of global GDP. As of now, 2020, fast forward, it's now China is now 20 to 25% of the global economy.
Well, we're hearing that Laurie Laird, our business correspondent, is with us. Laurie, can you hear me? We were talking about the impact of COVID-19 on the global economy. Laurie, give us your thoughts on that.
Good evening to you both. It's nice to see you both. And I wish I could give you something comprehensive, but modeling this one is almost impossible. The way that economists tend to forecast future events or the trajectory of the economy is based on past events. We have not seen a situation like this before. So economists are really flailing around a little bit, trying to come up with accurate forecasts. And I have seen, at least for the U.S., predictions of anywhere between a 3% decline in first quarter GDP to a 15% decline in first quarter GDP. And remember, first quarter GDP only goes through the first 3 months of the year. Yeah. This really only began to hit the U.S. economy in the first week of March. So the real damage will be in the second quarter of the year. But one thing that's interesting is we see economists are already predicting unemployment to hit 10% of the workforce as soon as April, and that makes this a very different recession, should it be a recession, and I don't think there's much question about that. That makes it a very different recession than we saw in 2008, and that was a very severe recession. In 2008, that recession began in the first quarter of 2008 when GDP fell by 0.25%. quarterly rate of 1.2%. But unemployment didn't peak at 10.2% for another 18 months. It took a while for those job losses to work their way through the economy. Not so much on this one, if economists are correct, and unemployment does hit 10% or more in April. It means that unemployment is hitting the economy. Many people are losing their jobs en masse, on an onslaught of unemployed people. That's very different than in 2008.
Alex, Lightway, I want to bring you in here. If you just heard Laurie Laird, our business correspondent, just giving her thoughts on the economic impact of the United States. Alex, I wanted to ask you, what is the role of data, mathematic modeling, and science in preparing for pandemics with regards to how one could possibly, although this is being called a black swan event, one could possibly prepare for something like this with regards to the effect on an economy?
Sure. Nassim Taleb, the guy who wrote the book, The Black Swan, says it isn't a black swan. We can expect to have more of these because we have scientists all around the world doing gain-of-function research where they use serial transmission of diseases through animal reservoirs like ferrets and bats to make diseases that are more contagious and are more damaging. And this is the result of some of that research. And the fact that these same gain-of-function scientists are now outgoing and not even talking about their work and trying to say there's no man-made origins means we haven't learned the lesson from this at all. The second thing is that I've heard President Trump say nobody could predict this. In fact, many people are predicting this. Bill Gates has a 2015 TEDx talk or TED talk in which he's predicting exactly this. And then there's the Agenda 201 conference that predicted exactly this. So I could actually name over 50 people, if you needed me to, who predicted exactly that this would happen, this kind of pandemic, and most of them even called it out as coronavirus or avian flu or SARS, those kind of things. So viruses have been around for 1.5 billion years, and as I was saying before, we haven't really come to grips with viruses. But and we also talked about before, to bring new viewers of Arise up to speed, this is a demand shock, this is a supply shock, this is a market shock, and this is an information shock. So we all need to get up to speed about viruses, about contagion. And as I was saying before, Nigerians and Africans have an advantage because they did a great job in stopping the Ebola outbreak that happened, stopped it cold. And I have also, this is the disease more than any other that I've ever heard of that attacks the elderly. The median age in Nigeria, as we just discussed, is young. In fact, I'll tell you what the number is. The median age in Nigeria, so that age, people are, half of them are younger than that and half are older, is 19.7. So Nigerians have a whole superpower, which is a young population. And Africa is pretty similar to that. The average life expectancy in Africa is 61 and 65, 66 for women, depending on which statistics you look at. And these are not the groups that are most at risk. So Africa should come out of this much better than might people. So there's no reason for Africans to panic. Your youth is one of your strengths as long as you stop your socializing. You can't fist bump, you can't shake hands, you can't hug, you can't kiss. You just have to be cold, which because Africans are in general so warm and so communal and so friendly to each other, you have to change your mindset and be more cold. Think of Swiss people, or Swedish people or something. You have to be colder than normal. And as far as economically, my estimate is that the U.S. GDP will take a 10% hit. So the world economy is around 86 trillion a year for gross global product, and the U.S. is about 21 trillion a year. So we're going to do about 2 trillion less. We're going to have a lot fewer restaurants open, movies and all that. And the service economy in the United States is between 70 and 80%. And the service economy, people serving people in close proximity, that's going to be dead in America for at least the next 3 months. Now, one of the big things that we have to look at and you have to think about is how much money do you have in your corporation? How much money do you have at home? And if you have less than 6 months, then you have to stop spending money as fast as possible because
this will last a long time. You have between 6 months and 12 months, you have ability, and if you have 2 years or more, you're in great shape. But basically, everybody should sit down with family, everybody should sit down with employees and do a survival plan. So I'm the CEO of Kimoji.com, and we have I have 22 people working for me. We make software that helps track people and helps them protect privacy and security. And we're going to be shifting people over to working on how you can basically have credentials and say, look, I don't have it. See this? I can go into this place. Or I have had it and now I'm cured and I have the antibodies, so I can't get infected. So we need to know who's had it, who hasn't had it, and who's had it and has no signs and can't infect others.
That's vital. If you could just give us a moment while we switch gears and look at Laurie. Laurie Laird, are you still with us there in London? Yes, you are. Great, fantastic. Well, if you were listening to Alex, he did mention some really interesting things. He said that the US economy is expected to take a 10% hit. In light of that, do you think America's $2 trillion rescue package is robust enough?
This is one of the biggest fiscal policy experiments the world has ever seen, Femi. And let's back up a little bit, because many economists worldwide were having a debate about fiscal policy before this hit. There was an acknowledgement of the fact that interest rates across the developed world were at or near record lows. So many economists were thinking about what happens if a recession hits, if a global shock hits, with interest rates at or below zero in so much of the world. When the financial crisis hit in 2008, interest rates in most of the developed world were north of 5%. So that gave central banks a way to combat the slowdown. They could cut interest rates, free up the price of money, and try and get money flowing through the economy. As Alex mentioned, 80% of the U.S. economy is on services, is made up of services. So getting people to spend on those services is crucial in keeping an economy afloat. But with interest rates so very low before this shock to the system, that means that fiscal policy, and that essentially is government spending, has to be the way to get an economy moving, or to keep an economy afloat, if you will. And there's much debate, has been much debate in an academic sense, about the best way to spend that money. Does it make sense to give people money, as the U.S. government has just done, sending checks to all Americans that make less than $75,000 a year? Does it make sense to subsidize businesses so that businesses will continue to hire people? Does it make sense to expand social unemployment insurance? And this is an experiment that we are seeing playing out across the world right now. Unfortunately, we won't know the results for a while. Certainly, some economists have queried the headline-grabbing element of the $2.2 trillion fiscal package, which is sending those checks to all Americans. Some economists fear that if Americans think that there's a further shock coming, they will take that money. They may not spend it. They may stash it away for an even rainier day. So many economists think that subsidizing the unemployment system, subsidizing job creation, so that people have a monthly or weekly income coming in, may be a more effective way of ensuring that people continue to spend. But as I say, the jury is out on what is the right way. Also, subsidizing business comes with its own risk. It causes resentment within a population. And let's look at airlines very briefly in the U.S. Airlines were subsidized to a great amount of money during the financial crisis. They tended to use their free cash flow for things that were not very conducive to a society, that were more shareholder friendly, like share buybacks, like increasing dividends, like giving CEOs hefty pay packets. So that is controversial as well, bailing out companies. We don't have the answer yet. There will be a lot learned from this experiment.
And Laurie, what about the long-term impact as far as what is transpiring now across the global economy? If you want, I don't know if you want to start with perhaps oil prices. Like Nigeria is a commodity-dependent nation. We see how COVID-19, what it's done to oil prices with regards to how OPEC has reacted. What's the long-term impact, I guess, from oil prices and beyond that, in your estimate?
I mean, oil prices are a very interesting question, and you're absolutely right to talk about Nigeria and many other developing economies that are dependent on oil and dependent on exporting natural resources. The fall in oil prices has really taken the headlines, but other raw materials have fallen in price as well. Nickel, copper, iron ore have all fallen in price. Gold has stayed okay because it's thought of as a safe haven, but this will be very problematic for so many resource-dependent economies. So many economies, Nigeria included, Saudi Arabia as well, have talked the talk about diversifying their economy, but they haven't walked the walk. And we have seen very little progress on that since the last oil price crash in 2016. But as for further afield, what happens with the developed economies? What do economies look like after this? Certainly, we're seeing a great advance of government into the real economy, and we will see more of that. We will see more partial nationalization of industry. We've already seen in the UK that the government has started to nationalize, in all but name, the transport operating companies. The government has told airlines, don't ask for a bailout from us, but if we do have to help you out, we're going to take an equity stake in that airline. In the first instance, we will certainly see a much, much more active presence of government in industry.
All right, are we gonna take some questions from social media? Do we still have any more there?
Sure, we do. Well, here we go. As we know, the British people, they are famous for their stiff upper lip. Even during World War II, when London was being bombed night after night, the motto was keep calm and carry on.
Right, the British are also famous for their quirky sense of humor, if you want to call it that. After all, they gave the world Monty Python. So while there's nothing funny about the COVID-19 crisis, we're not surprised to find that the UK's most famous rock group is being used to give us some important information with a light touch.
Oh yeah, touch that something. I think you understand. Now I need a scrubbing. I gotta wash my hands. I gotta wash my hands. I gotta wash my hands. Don't sneeze next to me. Watch where those droplets land. To freeze this disease, I gotta wash my hands. I gotta wash my hands. I gotta wash my hands. 'Cause if I catch it, I'll feel crappy inside. I even want my latex gloves. Sanitized, sanitized, sanitized. Yeah, learn this one thing, the 20-second plan. Now my water's running. I gotta wash my hands. I gotta wash my hands.
So that's from the Beatles. I gotta hold your hand, so that they're using it as a spoof. They're spoofing. I gotta hold your hand.
Exactly, promoting the
I gotta
washing
wash
of
your
hands.
hands.
I
What do you
get
think?
it, I get it.
Yeah,
it just
works.
wasn't my type of song.
Right, but if you think about it, you have to use humor, right, to push this. There's actually in Nigeria, there's another funny skit where a man flies back from the UK or somewhere, and the security guard doesn't let him in. He says, Madame and the children say you should go and self-quarantine.
Self-isolate.
Right, and don't come back in the house, and it was pretty funny. So Nigeria, the UK, a number of folks are using humor to try to
spread
sell a
awareness.
message. Exactly.
Absolutely.
That's how you get a message through.
stuff.
Good stuff. Okay, and as we wrap up, Arise anchor Charles Anyagulu shares his thoughts on how this crisis will continue to affect us and how it will change the way we view the world.
Rotus, thank you very much indeed. And I and the Arise News team have spent most of the past month trying to get behind one of the most troubling and challenging stories I've ever covered. The story of an enemy virus that is systematically stalking humanity. Today, in a world taken over by whispers and fake news, gripped by shock and tormented by fear, Arise News has separated the facts from the fiction digging ever deeper to help us come to terms with this coronavirus microbe that is radically altering the way we live and work and potentially sweeping away long-standing assumptions and practices. In my years as an international journalist, I've covered many disasters, from deadly tornadoes in the United States to wars in Africa and earthquakes in Asia. But never has there been such vulnerability in the face of the power of nature. What sets this apart from major threats to humanity is the fact that most natural disasters are confined by area. An earthquake that strikes in China can't directly hurt you in Nigeria. But when a virus like COVID-19 infects a person, that person becomes what one writer called a cellular factory, manufacturing more viruses. As we've learned today on Arise News, a pathogen such as coronavirus turns its victims into its delivery system. It is this constant threat of disease that slows down human development, as it's doing now, with the machinery of global technology and economic advancement going increasingly quiet, and we find ourselves withdrawing in the face of the power of nature. But the human being is programmed to overcome. Just a couple of centuries ago, life expectancy was just 29 years, not because we couldn't live longer, but because many of us died early from disease. But then, as the writer Brian Walsh reminds us in his splendid book, End Times, A Brief Guide to the End of the World, we developed better sanitation, as well as countermeasures such as vaccines and antibiotics, a victory that created the modern world as we know it. And so it will be with the coronavirus pandemic, that when we've survived this battle and are finally free of the current precariousness of the human condition, the end of our confinement will have an echo that will sound joyfully through the streets, that we can survive, that we will survive, and that in that survival there is an epiphany wrapped in a message, that maybe we've learned something along the way to help prevent this universal catastrophe from ever happening again. Now back to you in the studio.
Thank you, Charles.
Thank you so much for that, Charles. You've been watching the Arise News Channel global briefing on COVID-19, the pandemic. We want to thank all our guests here in Nigeria, Lagos Commissioner for Health, Professor Akin Abayomi, Dr. Abiodun Aluko, Dr. Yemi Johnson as well. Thank you all so much. And of course, our international guests as well, right?
Absolutely. A big thank you to Dr. Yemi Aluko. We appreciate your time. And also to Helen Robertson-Gordon, there for us in the UK. And also Alex Lightman. And we cannot forget Professor Sean Griffiths. We thank you all for your time with us this evening.
Thank you very much. All right, and I think that's going to do it. Yes.
That is it.
Thank you for keeping me company.
Hey.
And thank you all for watching as well. Please stay tuned to Arise News and keep watching Arise News for all updates on the coronavirus. We'll be keeping everything. We'll be giving you live broadcasts as we follow the lockdown in Lagos, Abuja, and Ogun State, and keep you up to date. The curfews, yes, and all updates. Stay tuned to Arise News, and thank you so much for watching.
I'm Adefemi Akinsanya.
And I'm Rota Sodiri.